Yes.
Pam, I hope everybody's healthy at your house.
No, that's.
No. Sorry about that.
Hey, when you're ready, tell me and I'll hit this button.
Oh, yes, definitely. Ready.
Great, well,
Okay. So we welcome Superintendent Lambert.
Morning, Commissioners.
Staff.
I have my monthly report for December. The good news is the population trend did turn back a little bit. Our average daily population was 104 for December. So glad to see that trend start to ease for us a little bit. Still had a very busy month for intakes and releases. The firm program was busy with 506 hours of substance abuse disorder treatment, and inmate labor tracked pretty much on average. Our meal costs were up 1 penny, and again, it's simply the inflationary pressure that the citizens are facing. We're facing the exact same inflationary pressure. We've had 2 full-time chef positions and the 1 part-time chef position vacant all month. Our Corporal Lombardo and Officer Balch, who've been the 2 who've still been there, have adjusted schedules. They moved the hot meal to lunchtime instead of supper because that made it more convenient for scheduling to keep the kitchen running, and they've done an admirable job.
Good job.
We're still putting out the same amount of food, and next month I'll be able to report some success with hiring in that area. I'm going to skip over medical right now, if that's okay. We'll go through everything else and then come back because the medical report's going to kind of segue into the big action item. Still seeing a very high activity for our community corrections folks with 55 total people that they're supervising. So almost double what we were a year ago, which was 31. And we had a couple of significant achievements. The commissioners funded some more camera replacements. And last time that Cornerstone came, they weren't able to do all the work that we had wanted them to do. And we worked, Jim Oakes dedicated resources and man hours. There was a lot of work pre-done in anticipation of them arriving. Captain Kendall did an excellent job with scheduling it, staying on top of it. All of the work we wanted accomplished, including the makeup work from the last visit, was accomplished on this visit. So we got all of the outside pan tilt cameras and a number of cameras in the intake replaced and moved up to digital quality. The difference is significant. So we're very pleased with that. And we also had our PREA, Prison Rape Elimination Act audit.
Okay.
That's a voluntary process. Well, all correctional facilities have to adhere to the Prison Rape Elimination Act. Getting audited is a voluntary process that we can undertake. And it's one of because New Hampshire doesn't have like a state correctional accreditation for county corrections or a model jail standard. With inspections, this is one of the few opportunities to bring somebody in from the outside, look at our operation. PREA touches a lot of things from intake to medical, housing. So we got a pretty favorable report. We have some improvements that were suggested, and over the next 6 months, we'll be working on getting those improvements made, relayed to the auditor, and then we'll get a final report. Sergeant Brandy Knapp was our lead person on that. She's done an excellent job with arranging things, and she's currently working on the policies with the auditor's guidance. I was very pleased with
Terrific.
both of those initiatives. So jumping back to medical. We had the inmates coming in are in bad shape. We had one come in just before Christmas. The nurses assessed, immediately said this inmate needs to go back out. We took him to Cottage. Cottage evaluated them, said, oh no, this inmate's in way worse shape than we can handle, immediately transferred to Dartmouth. That inmate is still in Dartmouth. Most of the stay has been in ICU.
Oh dear.
And when they are released, when that inmate is released, we're looking at 3-day a week.
Dialysis.
Dialysis, thank you, which will be a full day. So, one officer and this inmate all day. We've had to borrow we have 2 hospital beds in the facility. We've had to borrow a third from the nursing home when this inmate arrives finally in our custody. There'll be a 4th hospital bed we're going to need. And when I checked in over what came in over the weekend, we now have a inmate who's wheelchair bound and needs staff to assist them in transferring to a commode and all the other assorted daily livings. I have Shay Albee, our nursing director, with me. But what she's relayed to me is that the nursing staff are at a breaking point. That the amount of work they're doing is out of the norm for corrections nursing, which I traditionally advertised to potential recruits as, hey, they're all walkie-talkies. There's not a whole lot of physical demand. They're pretty good shape. They're really not. We're really not getting inmates in pretty good shape. And I'm after hearing from Shay and her staff, I have concerns that we're about to start losing nurses. So the first action item.
So can we ask some questions?
Absolutely, please.
No, thank you.
Well, my question about the person on dialysis age, and are they a Grafton County resident, or is this from another?
No, they are Grafton County
They are.
resident. Had this been for someone we had taken as administrative transfer, either they would be responsible for those costs or we would have moved that inmate back so that they could more directly do it.
Okay.
They are, and beyond that, I know all of the bail reform is playing a factor in this. But the courts, it's not the courts are being cruel and inhumane either. This is an inmate who has failure to appears and has reoffended while out on release. So I think the courts are in a position where they're kind of running out of patience and running out of room to maneuver themselves on these medically needy.
And the age of this particular person is?
He's in his 30s, I believe.
That
He looks like he's in his 70s, but he's in his 30s here.
You also?
I have a question, just as a reminder, and for people who may be listening or watching, for the Department of Corrections, all the medical costs are borne by the Department of Corrections, including the dialysis.
the dialysis would be. Once an inmate becomes an inpatient at the hospital, then the hospital can set them back up with Medicaid and bill Medicaid, or if they have private insurance, which is very rare, could bill the private insurance. But for the emergency room, everything pre-admission is the responsibility of the Department of Corrections. And these dialysis visits are going to be a little over $400 per, is what Fresenius has told us.
So even though the general Medicare covers people on long-term dialysis, or is this not considered a long-term kidney failure?
The one issue is Medicaid cuts off. So the jail reports to Social Security
right.
every inmate that comes in.
And so it just cuts off.
It cuts off. And then once they're admitted, then they can be considered back out of our custody, even if the court.
And then even if it's a long-term end-stage renal disease, it counts back on the.
If they're housed with us and not in the hospital as an admit, then it's going to be back on us.
Thank you.
And really, though, the bigger expense is staff time.
Sure.
In that particular case, courts worked with us, got that inmate released on pretrial services. But as soon as they're released from the hospital, they're revert back to our custody. And that expected to come this week. should be coming to the facility.
And a pretrial inmate,
Pretrial inmate.
so we have no idea.
Could be years.
Could be. We'll continue to work with the courts on what our options are to try and minimize these expenses. But at some point, I also understand judges, some of these inmates, I believe, look at their health concerns as a get out of jail free card. And at some point, the judges have got to say, it's not working anymore. Yeah. So Nurse Albee has part of the first action item. Will be the one dated 1/14/26. You have my action item and Nurse Albee gave me a written document with what she was seeing. One of her staff nurses also had written up an assessment of what he was seeing. And I've included that. But the most immediate method of addressing the issue that medical is advising and I'm bringing to you as a request is to hire traveling nurses, 2 of them, between now and the end of the fiscal year. If this trend is continuing, I'm going to be asking for more nursing positions in the next budget year. We do not currently have 24/7 nursing. We have the hours between about midnight and 5, right?
Midnight to 5:30.
Midnight to 5:30, where we don't have any nurses in the facility. And I know our nighttime sergeants are often meeting the nurse walking in the door with a list of inmates to immediately go see before they even
Wow.
make it to the nurse's desk. And that's the time frame they're supposed to be getting their meds ready to do the first morning med pass. It's
So what level of nursing are we talking? LNA?
So it would have to be an LPN or an RN because in order to have an MNA or an LNA, you have to have an LNA, a nurse that they are operating under, and we don't currently have that staffing option, just because we don't have a nurse on duty 24/7. So as the superintendent said, we currently have a day shift and an evening shift. We don't have an overnight shift. Pretty much daily, the OIC is meeting the morning nurse when they come in, saying, I have all these urgent people I need you to see, things that happened after the evening nurse left that the officers are feeling overwhelmed with dealing with, because of course it's medical and they're not medical individuals. So the current nursing staff, myself included, I feel we're at a breaking point, as the superintendent said, where we have nurses that are scared, basically. We operate under a license, and it's concerning to
Absolutely.
your nursing license when you're for healthcare in a facility. So look, if I tell you a little bit about myself, so I've been a nurse this is my 20th year. I originally worked at the old jail in, I think, 2011, and have worked here now. This is my 6th year back at Grafton, and I'm a critical care nurse by most of my years of service were in critical care, working in critical access, emergency rooms and ICUs, as well as level 1 tertiary centers such as Dartmouth in ER and ICU. So I don't scare easily. And I was just thinking about this on the way in, between my nurses and my 4 full-time nurses and myself, we have about 120 years of nursing experience combined. So none of us are new nurses. We've all seen a lot. And I think actually one of the statements that we've, jokingly and now say is, I used to feel like I worked in a primary care office when I worked in corrections. Now I feel like I work in an emergency room or an urgent care, but with no provider. So we have the medical provider on Wednesdays in person between 2 to 3 hours, and the mental health providers on Wednesdays in telehealth for 4 hours. Other than that, it's myself and the nursing staff that are taking care of everybody. And with about 100 inmates on a regular basis, it's just too much. It's not safe nursing care, and that's not something that nurses like to say. We don't want to be in that environment, and we want to do the best that we can. Just because we're nurses that work at a jail doesn't mean that we don't have empathy and that we don't want to take care of people, because we do, because it's otherwise it's a thankless job in what we do. So We are feeling overwhelmed. We're feeling like if we could get some overlap of staff and get the overnight coverage, number one, the officers and the inmates would be safe while there's a nurse in the facility overnight. It would give us staff overlap time because we could move our evening nurses back a little bit and have them available for more day coverage. It's not unusual to get, 3 to 6 intakes within a 2-hour period. And each intake for a nurse takes about an hour to do. So with one nurse on duty doing the med pass and with 100 individuals incarcerated, 100 patients for us on an average daily basis. Usually the morning med pass, we give about 50 to 60 scheduled medications for individuals on top of quote unquote sick call where they handed med slips. We have to have a provider order to give somebody an ibuprofen or a Tylenol or Tums for heartburn or anything. So any over-the-counter treatment or minor illness protocol, we have to have orders for, and we have to administer. We don't have any keep on person medications for individuals as they do in the prison because we don't. So they don't have their own bingo cards of Tylenol and ibuprofen. We have to give everything out. So the morning med pass is about 50 to 60. We then have a 1500 med pass, which is 20 to 40 people. And then the evening med pass is 60 to 80 individuals that they give scheduled medications for. And then with the med slips in the evening, they get, 20 to 40 med slips. So, that's a lot of medication. We're pushing around a big, huge med cart with bingo cards in it. And the nurses it takes about an hour to prep for a med pass, about an hour and a half to 2.5 hours per med pass, evening med pass, 2.5 to 3 hours for med pass. So an hour to prep, 1 to 3 hours for med pass, and then an hour of follow-up with all of your slips and sick calls dealing with individuals that came up. Oh, look, my face is swollen. I have a dental abscess. I'm having chest pain. I think I had a seizure. It's as Superintendent Lethbridge has indicated, the individuals that are coming in are not well. Mental health, substance use. And with that being said, not dealing with chronic medical issues or acute medical issues that they didn't even know they had. We diagnose people with diabetes that are 50 years old. I didn't know I had diabetes. Okay, well, you do, and you need some help. So, for instance, the individual that superintendent was talking about that came in that is wheelchair bound, she has MS.
Oh, my goodness.
Yeah, she is basically a paraplegic. She has no mobility from the waist down. She requires assistance with all ADL's activities of daily living, dressing, showering, toileting. She had episodes of loose stool last night on 2 occasions, so the nurses were changing her and cleaning her. From that, thankfully it was that change of shift so that there was two nurses there. Otherwise there would be one. I myself went to move her when she first came in, and it took 3 of us. We would call that a max assist of 3. It took 3 of us to transition her to a standing position to pull her pants up. So we don't have the capacity to take care of individuals like that. And that's just one individual in the facility. And then, we have the individual coming back who's going to be on dialysis, which is an extreme infection prevention risk, as I'm sure everybody knows. And he'll require some bedside nursing care. We always say we don't have bedside nursing care, but we have been. And the fact we've had the 2 hospital beds for absolutely forever. There was only one when I came, and we actually needed another one. So we borrowed a sort of what we called the dinosaur from the nursing home basement. They were gracious enough to, I said, it doesn't need to plug in. We don't have plugs in the cells. I just need a bed. So we have 4, we currently have 3. We're going to need a 4th. The other 2 are occupied by individuals who one has Parkinson's and one has a neurodegenerative disorder. So they have limited mobility. So they use rolling walkers. One of them also has seizures. One of them also has a brain tumor and a cardiac defibrillator. So it's just a lot. And, the mental health crisis that we're dealing with individuals that are getting dropped off from Dartmouth and Cottage and Spear, who are in the process of an IEA, which is an emergency involuntary admission, and they can't keep them any longer because they have to wait for a bed. So they say, well, we'll just send them to jail. So here I have, probably they acted up a little bit in the hospital, but they have mental health issues. So yes, that's going to happen. So they come to us in this acute psychosis, often unmedicated, and then I'm tasked with trying to pursue the IEA petition and
To the IEA is to the state hospital?
correct. There are designating other DRFs, designating receiving facilities, but they're in southern New Hampshire, Portsmouth, those kinds of things. And we only, I think once in my tenure at Grafton, have we sent somebody to Portsmouth. And that was just because I think it was during COVID and New Hampshire Hospital was down 60 beds, I think. They're still down 30, by the way, for staffing. I asked them, I think last month, and they were starting to use some of the DRFs, other DRFs, but they are so inundated with their own local individuals that are taking up the mental health beds that they really can't facilitate outside this facility patients. So it's very rare and they just can't accept anybody either. So it's beyond challenging and the current nursing staff. So this is Mark Tuthill that wrote this up. I actually worked with Mark in the ICU many years ago at Cottage. And he said to me the other day, he said, Shay, I'm not dramatic. I'm not scared. I know how to take care of patients. He said, but I'm literally scared until you come in every day because I'm worried about what's going to happen, not having another nurse in the building. So we're very used to, as medical professionals, bouncing ideas off each other because, you know, human beings are complex beings, you know, the human body is amazing, but scary. So, you know, we're often trying to bounce ideas off each other. Well, I saw this, what did you see? You know, so we have our medical provider, like I said, on site only for those 2 to 3 hours on Wednesdays. Other than that, we call her with issues, or we send people to the emergency room if we know that we can't care for him. So the individual that Superintendent Lethbridge was talking about that was getting the dialysis, I was there that evening, thankfully, when he came in, I want to say 6 o'clock at night. It took the other nurse and myself about 5 minutes of assessing this individual to say, oh no, he has to go. So he, like Cottage Hospital said, he exceeds our level of care. Excuse me, he exceeds your level of care of an emergency room, but here he is with me.
You have no authority to reject them at the
New
door.
Hampshire
and
does
say,
not have a statute allowing jails to refuse. We ask, many of our police departments are cooperative and will be willing to take them. But it's hard, our intake officers are not medical professionals, and if the person's walking, then they may not be aware. It's not always, you know, I'm not gonna say it's the arresting officer's fault all the time either. There is a very concerning bill in the House right now that would make jails responsible for every arrest pretty much from the moment of arrest. It would, in my opinion, would incentivize law enforcement to arrest people in their hospital beds because they're easy to find at that moment. And then the jail would be responsible immediately to put an officer on them to secure them. And jails are always going to be the bottom of the criminal justice pecking order, but it is particularly acute with the statutes in this state. One of the other factors that Shay hasn't mentioned is because Dartmouth is in our county, we end up with, so one of the recent larger medically needy inmates was a gunshot wound victim shot by law enforcement in Vermont. No New Hampshire charges, but Dartmouth was the closest trauma center. So he comes to our jail and we have to hold him. We've been holding him for about a week until the extradition is taken care of, and then Vermont will come and get him and move him across the state line. But it becomes our problem immediately upon release, and we see that a fair bit as well.
He's still with us and he's one of the other individuals in a hospital bed. He actually still has a bullet in his body. And he needs to be IEA'd as well. So he has mental health and acute medical issues. So
What's the staffing ratio? What does your staffing look like for nurses during every day?
So currently we have 2 full-time day nurses and 2 full-time evening nurses. So they operate one day nurse Monday, Tuesday, Thursday, Friday, Saturday, Sunday. We have them, they do 4-10, so we have them overlap on Wednesdays, day and evening shift, because we have clinic on that day. So we see 25 to 35 individuals in mental health and medical provider clinics. So we need the additional nurse because we still have to do med pass and intakes and so forth. So Wednesday is the only day that we currently have 2 day and 2 evening nurses on. Because the afternoon site clinic goes into the evening shift hours. So there's also 2 of them on there. And that's it. So they come in 5:30 in the morning and they leave 3:30 in the afternoon, the day shift nurses, and then the evening nurses come in at 2 and leave at midnight.
And you're there during the day.
Yes, most days, yeah. So, but if I take time off, for instance, I was in mock today, but I'm here. I was going to be, thank you. I was going to be off on Friday for a medical appointment, which I no longer am, but I was going to be off and my nurse said, well, is anybody else going to, this is him, the one who's been a nurse also for 20 years. Is anybody else going to be here to help? Because I'm like, okay, no, I'm gonna be there. I'm not taking the day off. My appointment was moved, so I'm gonna be there. But it's that, and when I'm not there, if I do work on weekends if I need to do cover staffing and so forth, which happens on occasion and holidays. But if I'm not there, and let's say, yesterday I was on the phone or email with them, I would say 6 times about the current inmates that we have, the patients that we're taking care of, with the MS, all the xylazine wounds. I don't know if you know about the drug scene these days, but the tranquilizer that's in the fentanyl is xylazine and madamlatine, which is 200 times stronger than xylazine, neither of which has an antidote. Those both cause severe necrotizing wounds on the body. So we've had individuals that literally come in from the waist to toe, open wounds. Yeah, they now have field tests for xylazine and madamlatine. Field tests for individuals that are using, they give them out in treatment centers and emergency rooms so they can test their fentanyl for these ingredients. They do have a urine drug test for xylazine. They don't have one yet for forensic level. We were just talking about this the other day. They don't have a urine drug screen for madamlatine. I always want to say metamidate, which is what I used for sedation and with anesthesia, but it's not that. There's no way for me to test for that. So we started testing for xylazine because quite often if there's xylazine, there's madamlatine. And those are complicated by not only are they at risk for death in taking them, but the withdrawal from madamlatine can be deadly. It causes severe tachycardia with respiratory depression and elevated temperature. So they sort of basically go into a hypertensive crisis, withdrawing from this when they.
Can you give them anything?
There's no,
Withdrawal?
we can give them comfort meds for withdrawal. There's no antidote for those medications, so there's nothing I can give them to take that out of their system. So basically we do vital signs as needed on top of the 3 times a day at all the med passes for withdrawal protocol, and we treat them as best we can with medications. But the withdrawal from this, all of it, there's the fentanyl is in everything. It's even sometimes in the cocaine and the THC, marijuana. So it's pretty scary, just the withdrawal piece of it, that's on top of the other, medical, acute, chronic and medical issues that we're dealing with. The anomaly is somebody that comes in with a negative urine drug screen. We're like, you should recheck that. So we double cup a lot of people because it's hard to believe now because 80 to 90% of the individuals that come in are unfortunately using some pretty deadly illicit substances. So we're dealing with daily.
I just want to make a comment, and that is, thank you for your commitment and obviously your professionalism and for the care that you're giving the inmates and bringing to the department. And sorry that you have to be in this position. This is really, not to take a long view, but this increased acuity, for instance, that's really interesting. And it's just this year. It's just recent.
It is dramatic increase. My
Market rate.
first year here, we did have a couple of hospital details. But that had been my question when I first arrived, was how the department was functioning without an armory. And then we addressed that. And thank goodness we did, because recently, yes, we've been not constantly, we don't always have a hospital detail. We have regularly, we're having
Look
hospital
at that.
details, and having transport and custody officer program has been a lifesaver, because at least I know the officers going out have the equipment they need to make sure that they're safe, the inmate is safe.
Absolutely.
But Captain Kendall, I was talking to him, he said traditionally it's been fairly rare, maybe a hospital detail a year. And
Wow.
we're doing them every month, mostly multiple times a month.
Mhm.
And I just want to echo the thanks and, as a nurse, I understand the fear not only of the high acuity, but also the potential ramifications of your license and
Exactly.
where you're in, scope of practice or not. And, I just want you to know, and, at least I personally would say, want to support everything you're doing.
Thank you very
Absolutely.
much. One thing that I didn't mention that's becoming more and more prevalent is, the TNS law, the treatment and services, what's the other term for it? Preventative detention? No.
Treatment
TNS,
service.
yeah, so I can't remember, there's an RSA for treatment and services, so basically, for lack of a better term, what they used to call brassly back in the old days was drunk tank, okay, so we have that. So that an individual is brought in by the police department, because they're concerned for their safety, and they are either intoxicated or incapacitated in some way. And we'll have individuals, for instance, we had an individual come in, blowing a .489, which is
Surprised they're alive.
fatal, so, we would say, between 0.3 and 0.4, you're at risk for alcohol toxicity. Above 0.4, you're at risk for coma and death. And we have individuals that are coming in from the street, blowing consistently greater than 0.4, which is on top. So then my nurses are, myself included, because that's scary. Alcohol withdrawal is
Yeah.
deadly. Number one, the alcohol level can kill you, with the withdrawal from it can be deadly.
And you don't do, IV, you know?
No.
I mean,
So when this last individual came blowing almost a 0.5, we did send them to the hospital. I believe our officer took them because we're not able to decline at the door. We can request and say, please, this is not the safest place for this individual to go. I know that's what the RSA says, but it's truly not the safest place. And they do give them IV fluid and send them back. But at least, they got some fluid. I think the last time this individual has come in, I think 4 times in the last 2 weeks, but it's not just her, it's across the board. We get these pretty much every day. We get a TNS in, at least one. I think we got 2 in last night, but when she came back from the hospital after 2 liters of fluid, she was at a 0.33, which is still very high, but she was much more manageable for us at that level, and we weren't as scared of death. So that's another.
I mean, you make an excellent case in all of the information that you bring us for this need, and I'm sure it's been building over time and isn't anything new or anything we expect to see slow down. I guess my question is it's more of a Julie question in terms of the source of the funds.
Yeah.
That, and maybe this is the one I was thinking of this morning that I was more concerned about, that this is a non-renewable source of funds.
Right.
And my question is more around, can you make the case that for the amount of time during any 24 hours that you're spending, I'm thinking more the opioid funds, just because those may be renewable for 10 to 12 years. And are there enough hours in the day that are spent on addressing those kinds of issues that those funds could be used and
I would say that we spend a fair amount of our day, on average, we have 5 to 15 people on withdrawal protocol every day, on top of the TNS is quote unquote on a withdrawal protocol for that 24-hour period that we hold them, or they reach sober levels or have a safe ride. But our fair amount of our day is spent on
And
substance use.
And every med pass has a considerable amount of medical assisted treatment
Yeah.
involved in it too.
Mhm.
So yes, there is a large amount of their hours that could be related back to opioid.
so one of my questions is, after listening at the New Hampshire Association of Counties to I'm sorry, I'm not remembering the AG's name that did that presentation, but Buffetti, Mr.
Oh,
Buffetti.
mhm.
it seems like over the long term, we could apply for
Hmm.
additional opioid funds that specifically for an issue like this. That might be in more of an ongoing source of funding from the state funds, because remember, only 15% of the funds go out to the 23 towns and cities, which is a small amount for the large amount of funds that come in, and the state keeps the rest of that. It just, and the counties, he did say the counties could apply for those funds from the state portion of those funds. Since our portion is not as, I don't know, that's just kind of what was running through my head for that.
Good question.
We do a urine drug screen on it. For the most part, 100% of individuals that come through the door, because again, it's an anomaly that somebody is not using illicit substances. So we do those urine drug screens on everybody. It gives us also a baseline, you know, if they are so not using illicit substances, then what is this? What are these mental health symptoms? Okay, they are truly mental health and not substance related, because often it's difficult to ascertain which is which. So we do a urine drug screen on every individual. That's our goal.
So that's kind of partly a question for you, Julie, what you think about that? I see you looking at the numbers.
Yeah, I guess for me, for the short term, I mean, I know that I'm not sure if I'm understanding that you would advocate that we would be trying to fund these positions permanently from other sources other than, you know, the county budget. I know that talked to Superintendent Lethbridge, and his plan is to put 2 full-time nurses into his budget request for fiscal year 2027. So we make this a permanent, not traveling nurses, but our own staff. This was a immediate, how do we address this concern immediately? And that there's, you know, $427,000 in the LATCF funds. And my first reaction was that's the cleanest way and the quickest way to be able to just say, those funds are there, those funds are available, those funds take care of. The budget is prepared based on 2 LPNs at 40 hours a week.
Okay.
So, I mean, whether we could use the opioid abatement funds, I think I would feel more comfortable having some conversation with the state as to if that's a, you know, the right thing to be doing, because, you know, there obviously be people we're treating that are not opioid dependent, you know, as well. So,
But I think if they can make the case for that, they would spend at least, you know, how much of that time would at the jail, how much of the time at the jail do you spend dealing with that situation? Anything that's related to the opioid abatement or any of the things that are in that list of things that can be paid for with those funds? Because this is gonna end up being part of our budget for the next year, and they've Mr. Buffetti did say we could apply, this counties, just because we're getting some funds doesn't mean we can't apply for their really big amounts that they have.
So I think what I'm hearing Julie say, and what I certainly am hearing, Shay and, Superintendent Lethbridge say, is that we need this money now, and if we're not sure how this fits into the opioid abatement monies, that the LATCF fund would be the cleanest way to do it without perhaps violating some rules that we'd like to look into. I 100% agree that we should look and see if the opioid abatement funds could fund something for the future and not out of property taxes. But I think that what I'm hearing now, I just think we need to find the best, surest way to fund this now so we can get some help, because we're losing people will make it even worse.
$160,000 just for this next 5.5 months.
so the
And
other
that
thing
money
that,
is not replaceable that we use, which some other crisis could come up. I just feel like
well, the other thing that we could do is we could that's based on 2 13-week assignments for the 2 contract nurses. We could do half of that, which would cover the first 13 weeks. And then in that time frame, we could look at the opioid money and see
Hmm.
if it would be appropriate for us to use that. That just gives us the ability to say to them today, yes, go get these people and get them here and get them started. And we would then go back and look and see about using
How to
it.
apply for that.
Yeah, because the state only doesn't, they only do like RFP one. I don't think they've done one for 2 years at this point in time. I know the Granite United Way has much smaller amounts that they administer for them, but the state only does an RFP process not frequently. So we would
Well,
have.
they must
to
have
get
a
all
ton of
that.
money sitting in the bank
Yeah.
because,
They're hard to depend on. State
Yeah,
action
and
is.
I think Mr. Buffetti could help us. You know, I think it's what he came for, was to
Hmm.
push that use of that funds and make sure that we knew that that was there for this purpose, but.
And if we began this way and the answer was yes, the opioid funds would be appropriate, could we switch funding sources midstream or even retroactively?
Especially if we go through the, the 13 weeks or whatever that Julie, whatever the
Mhm.
number was. But that would help us know what
Yeah.
to put in the budget, because we're gonna start on that shortly. See what's available. I'm assuming that other jails are having the same problem, that this is not anything new.
Other jail, I've been talking to the other superintendents, that they're seeing similar, we seem to be worse than most.
Not interesting. And of course, we have Dartmouth.
Yeah.
That's probably a factor.
Yeah.
In the 2 years I've been here now, we've seen a number of shot by law enforcement people coming through, which again, seems to have been traditionally unusual for this area to have too many officer involved shootings, and I think maybe just the entire country seems to be on edge and the violence is
There
increasing.
you go.
Yeah.
Can I just make a quick comment?
Yes,
I just wanted to clarify something for members of the public regarding the property tax revenue. That comes into play when we'll be doing the budget. But I just wanted to make it clear what we're talking about. So there's 3 sources of funding that are from the federal government that are not based in property taxes. And what Commissioner McLeod is differentiating is that we have 3, 2 of the 3 are not renewing. And so those funds are finite. And so we're just interested in not expending, not depleting them for that reason. So.
when there's some other source. of
Exactly, when there's another
potentially
source,
available
when there's
that-
another source, and we've heard that
Right.
the opioid abatement, the state took what, 85%, gave us 15%. With the idea that there's more available, but that's a real arm wrestling match.
And related to that question, I just asked Shay, over a third of our inmates are coming in testing positive for opioids. So
I don't think it would take much to make the
Really?
case for how much of,
if we could fund a third of the nursing staff or an
Right.
additional, what would become the third of the nursing staff that way, I'd be happy to pull numbers, documentation, statistics to support that.
so today, then what would our motion look like? It seems like we have some consensus on addressing this today. Given our interest in that.
Are you talking about just paying for it out of, I don't know what your intent is. So are you talking
Well,
about
I'm-
paying for it out of?
I'm thinking,
Yeah.
should we address 80,000 of the anticipated fiscal impact at this point so they can get started? And in the that would give us half of the time period, and then taking that from the LATCF and then doing the work to look at the remainder of the fiscal year and ongoing.
That would be my recommendation. I would just make a motion
Okay,
to that effect.
I'm happy to do that.
Okay.
If you'd like, if you're ready.
Yes, please.
I make a motion to approve spending up to 80,000 from the LATCF funding for 2 traveling nurses for the remainder of the fiscal year.
I'll second that. Okay, all in favor?
I
Thank you, commissioners.
followed up right away with
Yeah.
a
just wanna
discussion
get
with the
started.
state.
Yes.
Yeah.
Thank you very much. Okay, the good news is the rest of the action
I
items are
know.
much simpler.
Oh, my gosh.
So I have several inmate transfers that I need approval on, both incoming and outgoing. And not sure which one you're seeing first. I have Merrimack, Rockingham, Sullivan, and Coas.
Well, I happen to co-op.
Co-ops.
Yeah.
We'll start with
Let's have
Coas.
co-op.
So Coas County requested our assistance with holding a sentenced male inmate because he'd previously been employed by that facility.
Yeah.
And I did accept. He's sentenced. It's a 30-day sentence. He should be eligible to perform work at the county farm or other duties. And I just need the commissioner's approval to accept that transfer.
I'll make a motion to approve the transfer of inmate Jordan Wheelock from Coas County to Grafton County.
Second.
Second, we have a motion and a second, all in favor?
Aye.
Motion passes.
Thank you, commissioners. And then the next one in my hand is Merrimack.
Well,
And
know
if
that
somebody
one.
else has a different one, I'm happy to grab it.
Thought I had,
They're in different emails,
Yeah.
because they came at different times, so
Yeah.
the first one had the majority of them
I
in
got
that.
Merrimack. It came in on the 13th.
Oh,
And
I
it's
got
one
it.
of 2
I
attachments.
got it.
okay,
Merrimack County reached out to all of the other 9 jails requesting assistance with holding inmates. We did have room in our minimum male housing unit. And I told them we could take up to 8 because this was not there was not a particular issue along the lines of what the jails normally work with. We did
Good.
put the same per diem that we charge Coas County. They sent us 4, 2 of them lasted 24 hours before they decided that they liked our accommodations less than Merrimack. I'm
Wow.
not going to get into the reasons that they cited. We did report those back to Merrimack as areas for their concern. The other 2 have been with us for about a month and we'll be returning back to them again.
so do we want to do all these separately, or can you?
I assumed all 4 could be done together. They all came from the same facility.
But each county we need to do separately.
Is that, were you referring to county?
Oh, yeah, I was referring to county.
Yeah,
accepting
I think we
the-
only have one more after this.
There's 2 more. We have
I thought there
Rockingham and Sullivan.
Yeah,
Sullivan's an outgoing one too.
So I'll make a motion to approve the transfer of inmates Manuel Soto, Adolph Nayadishimi, Sharif Johnson, and Nicholas Mady to Grafton County from Merrimack County DOC.
Second.
all in favor?
Aye.
Motion passes.
Thank you, commissioners.
Rockingham?
Rockingham?
Rockingham. So this was due to a familial relationship between someone in Rockingham and this inmate, where it was not going to be possible for Rockingham to isolate the 2. Requested again, it should be a hopefully relatively short term that this inmate is pre-trial.
So I'll make a motion to approve the transfer of inmate Eric Haney to Grafton County from Rockingham.
Second.
All in favor?
Aye.
Motion passes.
Sullivan.
And just,
Commissioner.
just as a point again, and you did say this before, that the sending county remains responsible for medical costs, so.
All medical costs, yes. And if the inmate becomes too troublesome, then we call that facility and say, you can come get your inmate back. And then the last one is we had a inmate come in, and again, there was a familial relationship where it was going to be difficult to impossible to keep them isolated. It would have created difficulties for our staff member. we requested Sullivan County, accept that inmate, which they did.
And so we need a motion to approve that transfer.
Yes, please.
I'll make a motion to approve the transfer of inmate Sarah Letourneau to Sullivan County from our DOC.
Second.
All in favor?
And also, just to add for the record, there's no cost associated with that, except we are responsible for any medical costs on that particular transfer.
My goodness.
Yeah.
Well, that was quite a,
That's a lot of.
My gosh.
Thank you for taking time out too.
Yeah.
Thank you
very
Commissioners.
much.
I really appreciate it.
Yeah.
I,
Thank you.
I'll send Jean the code of
Okay.
those invoices once we start paying this.
all right, I'll get with Karen to start working on, finding some
Shay would appreciate.
Yeah,
LPS.
thank you very much.
Maybe just stop there on your way.
I know, right?
Thank you, Commissioners.
thank you.
Thank you.
Everybody drive safe.
Thank you.
Coming to join us, we've got Grafton Regional Development Corporation and.
Sorry for the delay.
Yeah.
Oh, wow, yeah, no. Sorry, quite sorry, yeah.
Thelma, are you feeling well?
I've got a little bit of a cold, so I figured. The season, mask up, yeah.
Oh, that's a hard act to follow.
Yeah.
Yeah, good luck.
Yeah. Well, I guess the question that crossed my mind, since, staffing really came up is, are the departments here seeing childcare as an issue in staffing? What crossed my mind is that Sullivan County has been looking at putting a childcare facility.
On site.
Yeah, and we have been ramping up our childcare work. And in Lebanon, we have a potential site. We've done site work. We're talking to some potential national funders of this work. And so it's starting to cross my mind, where are some other places in Grafton County that might be good to locate childcare centers? So that was just me sitting in the corner.
Yeah.
Listening. to
Hearing all that
cost-
information.
The cost of
The needs of staff.
LPNs, traveling nurses and such.
Do we hear about that? Do we hear about childcare needs here for employees? No.
We have not historically in the past,
Yeah.
it's not.
Hmm.
But it's not something I personally probably would know. That's
Yeah.
probably more of an HR question of
Okay.
if they have any, or department heads even, but it's not something I've heard.
It would be interesting to know. I would be interested because the other employers like the hospital do see this as a big challenge, and we're going to be meeting with a number of the major employers in the next couple of weeks
Mhm.
to gauge their interest in getting involved in trying to find a solution path forward
Mhm.
on this.
So maybe have a conversation with Karen.
It's
Yeah.
something we've talked about in the past. A number of times we've talked about it in the past. And I don't know where Sullivan County's thinking about putting their childcare center, but our challenge has been we're all one contiguous campus and we have inmates
Yeah.
all over the place here and, so from a liability standpoint, how do we control mixing those two populations? And the other times that we've had the conversation, we also really couldn't identify a place. And now that the old jail's gone, it would be a little bit different, but we don't really have a lot of outdoor space where kids could like play.
Well, I'm just
Those
talking.
were the challenges
Yes.
that at the last time that we looked, which was a long time ago.
Okay. Just always looking for opportunities to
Thank you.
make progress on this.
Definitely
issue.
something we can, do some outreach on and see if it's a concern.
Yeah, I'd be interested to know because Michelle is also doing work identifying opportunities for childcare in northern Grafton County. We recently received a grant from a new funder to do that work, so we do have some capacity to work with potential providers. And if it is an issue, that gives us a little bit of a link to potentially help if it's an issue. The stories I've heard from other employers, I've been kind of surprised at really wasn't an issue at all, but it may
Right.
not be as dire here as in some other areas. So that's our lead new thing is the childcare work, which is really ramping up. We've been working very closely with the city of Lebanon
Yeah.
on a site for them to build a childcare center with the funding that they received as congressionally directed spending. So they've got a $1.6 million designation. So we've been working hard to try and get a site identified and a potential plan for a new childcare center. We got additional funding for an architect to do the professional work. And just last night, I got a ballpark number on what it might cost to build a facility. So we're moving really quickly to try and nail down.
What's the
that money.
ballpark number? Can you?
It's less than $22 million, I can tell you that. It's under 5, so it's in that ballpark, but that's a pretty big difference. It's fewer slots, but probably a little bit more manageable in terms of actually finding the funds to build it. Since it's already 1.6, that's a great start. So we are looking for other sources to be able to do that. So in addition to that, we've identified how many more childcare opportunities?
Well, probably around 4 that we're currently working on, and I can give the update on the Canaan.
Sure,
location.
yeah.
So I think I've mentioned that we've been working with a family child care in Canaan, and then one also in Wentworth. Both have been moving forward, and the Canaan spot, I think I had updated you all that the law had changed that allows folks to open family child care now in a commercial location. And so this woman in Canaan was able to open what they're now calling a small center, which follows the family regulations in her local church. And it was licensed as of January 5th. So very excited about that.
Congratulations, that's
Yeah,
wonderful.
Thank you. So she's now licensed for 12 kids, and she had previously only been able to have 4. So and it's good timing as there is one other family child care provider in Canaan who is retiring in the next year. So so definitely needed in that area. And then aside from that, there is somebody in Wentworth that is continuing to, she's started construction on her barn. She's turning her barn into a preschool, and it's all moving forward. She has hoping to have a start date in September, so aligning with the school year. So that continues to move forward, and we continue to assist. And just to back up to the Canaan actually both locations, we were able to pay for the through some of our grant funding, the lead certification assessment. So that was necessary in order to move everything forward. So those are our 2
Lots of
family
details.
family care updates. And then did you want to talk about Orford?
Well, in Orford, we're talking to the people of the church, the Orford Congregational Church. There used to be a childcare there quite a while ago, but it's still set up. So we're having some conversations there about reviving that as a childcare center. Wouldn't be big, but would be local. And we are talking to some local residents and getting, let's just say, enthusiastic responses to that. So really getting out there into the communities. Once again, you folks are super connected. So you hear of any opportunities, buildings, sites, just, think around about where the possibilities might be.
So, may I? So Hemi Valley Habitat for Humanity recently was gifted the Northway Bank, which is
Oh,
downtown in
yeah.
Plymouth. And they are looking for ideas of what to do with that
Okay.
building because they don't have any preconceived notions. It was, there was a community conversation about it this weekend and they're really looking for any ideas. There's not play area around, so I don't know how it would be for a childcare center, but that is a space that they're looking to do something with. And so reaching out to the executive director if there was any interest might be a site because they said kind of
Bring
no
your
idea,
ideas.
no idea is a bad idea. So, I mean, and there were some silly ones,
Yep,
but it could be, again, there's not green space.
Floor.
Well, there actually is a basement that has offices. There's, the center area is, very high ceilings. I don't know if you ever were.
Oh,
in it,
yeah,
but
it's an interesting.
yeah, so it's an
building, yeah.
interesting building, but they're looking for ideas of what to do with it.
Okay, I love that. That's a very good location just in terms of, people with activity right there. So childcare is something we're working on and, going to meet with some funders in Manchester in a week or so. So it's interesting, the national level, they are looking for opportunities to invest in childcare in communities. We're kind of a guinea pig, I guess, for rural area doing this. And so there are funders out there waiting for us to get far enough along to have something to ask them to do.
good to know.
So we'll start learning about that landscape and if there might be some funding there to get some of this done. So I'm excited about all the what's it, Invest in America
Yeah,
activities.
yeah. And I think Warren Buffett's organization is
Oh.
one of the big backers. So
So we'll see how that boils down, but it's exciting to be making some progress in this area. Micro enterprise continues.
yeah, we're doing very well with the micro enterprise grant, and we will be here next week for the public hearing. So
right.
can probably get into some details there, but we finished half of the year. We're about to submit our application for the next round. So you'll be seeing those numbers come in and those requests for approval. I think we'll be able to serve a few more clients in the upcoming year since we have expanded our capacity, and that's working out really well. And yeah, we're bringing in a lot of new clients in the past couple months. So
And the direct grants have been popular. One of the applicants, one of the grantees for last year, Belknap County, has discontinued its work this year. So there may be some funding that we can access for more of our direct grants that has been very popular. I don't know what strange things we bought this year, but
well,
it's always interesting.
the big one that it sticks out for me is the bone saw for the butcher.
For the butcher.
That one was a little bit of a weird, we have to pull it up and look at all the specs and everything. So
That's nice. I mean, it really helps the small business
yeah, absolutely. Yeah.
get over that, and get into what they need to be doing and.
Yep. Yep. We have a new salon owner. She purchased the salon from her former employer. And so everything was pretty run down. So she's going to be able to get all new chairs for the salon. So yeah, just little things like that make a really big difference for people, especially when they're just starting out.
And the lending tie-in continues to happen. We are doing our lending to micro enterprises, and actually, we're doing a gap loan with Passumpsic Bank this week. Should close this week, maybe next week, for an employee purchase of an existing building and existing business in downtown Littleton. So it's a familiar business, and we're excited to be able to work with the bank to make that transition to a new generation of home. So everything's on track. I know you're probably a little behind in your
Yeah,
agenda because of
behind.
the depth of that discussion. But that's just the general overview. DRTC is going great guns and providing a space for the business that's buying the building next door to expand. Tens of millions of dollars worth of investment in upgrading that building. So that is going along. Enterprise Center, we're getting a new tenant momentarily, I think. So that's moving in the right direction. So we're just continuing our usual work plus the childcare. So it's exciting to keep doing what you do well, but also trying something
Nice,
new and
good.
Well, we appreciate you
Thank
coming in.
you.
Yes, keeping us updated too.
Well, it's
Absolutely.
always a pleasure to come. And do you have any questions based on that?
No, I'm all set.
don't think so, but thank you.
Okay, well,
Love
Thank
that
you.
conference you're
Yeah.
doing.
Thank you. Good rest of your day.
We'll see you next week. 3-minute break.
Yes, yeah, I'm back.
We're gonna take a 3-minute break here. And have a long morning.
And I work on the UNH campus. Throughout my time with Extension, which is about 25 years, I've taught classes quite a few times with Heather here in this county complex. So we started just right around the same time with Cooperative Extension, me a little bit before you. And the way that we're organized at UNH in terms of our agricultural education, research, and extension is, as you may or may not know, UNH is a land grant university, and we are a public research university that's funded by Congress to do this work. And what makes us very unique is that we have a tripartite, almost like a cooperation with the counties, the state, and the federal government to fund our work. And so that's where the name cooperative comes in for Cooperative Extension. One of our sister agencies is the Agricultural Experiment Station. Every public university like UNH, there's one per state, has a cooperative extension system, an agricultural experiment station, and that is directed by Anton, who's on his trip here right now. And then we have, of course, the education that happens in the classroom. So we work together to generate new information through scientific study in the agricultural sciences, as well as forestry and wildlife, some of the other natural resources sciences. We work together to sort of feed that loop where we're doing work that is actually important to people that farm and are foresters and fisher people and so on, make their living from the land. So we like to think of our public research institution as relevant because we're doing work that people like Heather, who are out working with the farmers and boots on the ground, are basically telling the researchers what kind of things need to be studied. And that's really what has advanced agricultural science in our country as well as the world. That's why we can grow way more food on a plot of land now as compared to 100 years ago, is because we figured out how to do it efficiently and effectively, plant breeding, plant fertilization, taking care of the soil, and so on and so forth. Same goes for animal sciences. We've become more productive. Cows produce a lot more milk and better quality milk now than they did, say, 100 years ago, 50 years ago, even 25 years ago, even. And that's because of the agricultural research that's done in every state. And so what Anton wants to come and talk with you about today is doing some of the agricultural research here on these county grounds. We have a history of working here with the county on this land. And you may know, of course, that we have actually a cooperative dairy research project here right now. So we're very proud to do that. And as you know, I think Heather has been doing work, also vegetable variety trials for a good number of years.
I think the first one was in 2010.
Yes, so unlike every other county right now, Grafton and UNH we have the one partnership going on. We don't have any research at any other county farms. anymore because there really aren't any real county farms anymore. There are, the properties still owned by counties, like in Merrimack, and you'll see things growing there, but it's really more to feed the residents in the nursing home and give the people at the House of Corrections something to do, work release type. But this is the only true operating county farm, as you know. So that's why Anton wants to make a proposal to you. And it would be using federal dollars that are sort of out there. And I don't want to make a mistake and say what the name of the program is, because this is really his gig and I don't want to make a mistake, especially being recorded. But there are federal dollars available for rural development. And he believes that it may be a nice opportunity for UNH to expand its research here on the county grounds on this property, and wanted to find out if you're interested in seeing that happen and maybe get some recommendations from you about the next step. Because one of the limiting factors may be that in order to get one of these federal grants, you have to have the town apply. It can't be UNH and it can't be the county of Grafton. It would have to be the town of Haverhill that applies. And we could do the writing. We could write the grant in cooperation with you so that you know everything that goes into it, what the time commitment would be. But we actually don't have a relationship. We don't really know anybody and have any kind of lasting relationship with the government of Haverhill. So we were hoping to kind of have a little bit of a give and take with you to see if you're interested in pursuing this and take a temperature if you think it's a smart idea or not a smart idea.
Maybe a representative would want to be involved.
Yeah, that might be a way to do that.
I mean, the representatives certainly work closely with their
Yeah.
town governments. I mean,
Yeah, I don't know.
I
There are two, I think there are two, aren't they?
Jellicoe and
Rick Lyons.
that's right.
But I think first it has to be a conversation with the Board of Commissioners as
Oh,
to
yeah.
whether you're interested in.
Oh, yeah.
Yeah.
I'm just
Yes.
waiting for Anton. I'm just
Yeah,
getting from. He's okay on the road,
yeah.
significantly.
I texted and he said that he just hit a whiteout, so we.
Oh, my gosh.
White knuckling it.
Oh,
But,
He must be getting fairly close because there's a dead
Yeah.
zone between Plymouth and here, so.
Right.
he had cell
If
receptors.
he's able to text, he can't be that far away.
There's a.
It's much better, actually, it's much better between. Plymouth
And there's a few places
Yeah.
that are like,
Good now.
there's a few that are dead and then I get messages. Some days I get a few when I get into the zones.
So he might be further out than I was thinking.
Who knows? The whiteout had been fairly close to here, but I don't know how far, when we came and out, an hour and a half ago. I don't know where it is now.
If you wanted to wait.
Yeah, we could do that.
some of
That way
your-
you could do your business.
That'd be great.
Yeah, I apologize.
No, we understand.
Thank you.
they
Thank
started at a half-hour delay
Yeah.
with our, yeah.
Okay, well, we'll just step over aside and thank you for understanding.
All right, so if we could look at our minutes from
Yep.
1/6/26, and Sam, are you online with us? Around.
I didn't have any
I didn't either.
Any corrections?
I actually had 3.
If you weren't paying attention.
I let Sam know, the first one is the participants. They weren't noted who was in person and who was by teams, and they usually do that, so she was going up to update that. The second one was under the nursing home discussion, about the bid waiver and the increase in the quote. Nursing home administrator Labor stated that there'd been a $10,000 savings elsewhere. And I asked her to double check in the recording to make sure I had not misremembered that. And added it, and she did verify that she went back and he did talk about the $10,000 savings and one of the other capital improvements. And then the last one was under the commissioner issue number 1, and that's when talking about the EMS. When there was, they, in the statement was about the towns needed to approve the EMS district, and I requested to add the word conditionally because it has to be a vote this year and then the next year, which would be the final approval. But the conditional improvement of approval would let them be able to continue the work on it. So those were my 3 changes.
I'll make a motion to approve the minutes as amended.
Second.
All in favor?
Aye.
Okay. We then have a number of check registers that we need to review and sign. Yep. The end of this. Yep, there it is.
You're a very bad influence on me with the signature. I've been working so hard to try to make my
Make
signature
it
more.
real.
It's like, okay, well, then I'm doing that too.
I feel like I remember doing these way back and when I first started and somebody must have been home or somebody said to me, oh, I just put my initials on there.
These, really?
Yeah. And then when I was like, oh, what am I? Yeah.
I know when I have to sign it with my finger on a.
Oh,
it's kind of, yeah.
That's it.
Oh,
They're gonna do that, then that's what they get.
yeah. Oh, okay. I don't think they care. Like,
Oh, okay.
The big one.
Yeah,
Thick
I'm
one.
gonna say, my God.
I know.
That would hurt physically and.
Well, you had a lot of big folders for me to sign last week.
did. All right, next up will be the register of deed request around holidays. Is this different than the ones that we did last time?
This is a request from the Register of Deeds to have the Register of Deeds office closed on December 24th, 2026, and to close at 1 PM on December 31st, 2026. So close on Christmas Eve and close early on New Year's Eve.
Oh, she's ahead of.
And the employees would use earned time
Obviously,
for
that
those
was
2
the
days,
question.
off. Those day and the closing early.
Anyone have any questions?
No.
I have no objection to it.
No, I don't have an objection.
I'd make a motion to approve the Register of Deeds request to close the office on December 24th, 2026, and to close the office at 1 PM on December 31st, 2026.
Second.
And all in favor?
Aye.
Motion passes.
Oh. Gonna expand your duties. for
Okay.
Livermore.
This is always fun.
Livermore has always had a zeroed out tax rate based on the fact that we've always had more revenues coming into Livermore from the
Mhm.
federal bill payment than expenditures. But recently, in the Rand versus the state of New Hampshire Supreme Court case, setting negative local tax rates in incorporated places to offset or zero out the statewide education property tax known as SWEPT violates Part 1, Article 5 of the New Hampshire Constitution. As a result of this decision, Excess municipal revenues, including the application of unassigned fund balances, fund balance cannot be used to offset swept. Basically, what this means is that this Department of Revenue Administration has had to set a tax rate for Livermore. And there are 3 property owners in the unincorporated place of Livermore that will be receiving a tax bill that will be for the statewide education property tax. In order for us to carry out this, you all need to appoint a tax collector.
For God's sake.
Linda Harris from Coas County is the tax collector for all of Coas County's unincorporated places, and is essentially has always been sort of considered that for Grafton County because she still does the tax information for the county for Livermore. So we need you to formally appoint Linda Harris as the tax collector for the unincorporated place of Livermore. And once that is done, then we need you to execute the property tax warrant for the $212 that we need to collect from the 3 property owners in the unincorporated place of Livermore,
Sorry about that.
so that Linda can send out the tax bills so that we can collect the money, so that when the Department of Education bills us, we have the $212 to pay them. Seems like a lot of paperwork for $212, but nonetheless, that's what's happened and that's what we need.
Okay, so 2 things here. Can we do them in one or?
No, I need you to do
2
that
different things.
separately.
So I will make a motion to appoint Linda Harris as a tax collector for the unincorporated place of Livermore.
Second.
All in favor?
I
Motion passes. Linda is our tax collector for Livermore.
And so the second is to adopt the property tax warrant for the 2025 second issue. And it just says that we're directing Linda as the tax collector to bill out the sum of $212. Property tax bills will be due on February 27th. Like I said, they're payable and come directly here to us. Then we will put them in an account and keep them until we're billed by the Department of Education to pay that money over to them.
Reasonable.
So let's see if I can get this
I know.
right. I will make a motion to adopt the property tax warrant for the second issue for the unincorporated place of Livermore. So our new tax collector can bill for the taxable taxes of $212
For the state.
for the statewide education property tax of $212.
Second.
All in favor?
Aye.
Hi.
Can I see the letter?
Just to. Very interesting. Thank you. Well. Gonna do another 2. Wow. Thank you.
Very
Yeah,
much.
I love you talking about Livermore.
And then you go bike it.
And then I go by, and I think you can do, you might be able to do snowmobiling in the wintertime. up
Yeah?
this way. I think so. Yeah. It's a very interesting place.
I'd like to visit, yeah.
And someday maybe the road will be open again and you can drive up in there. I don't think they know how to fix a huge hole.
Where is it? What road is it off? How?
Sawyer River Road off of, in Crawford Notch.
Okay.
And the river out a good part of the road. And it's on a very steep, like, not cliff, but a very steep area that there's just like no place to get around it, you know? Get on a bike, but
Yeah.
Here's the Antoine has arrived, so if you want to.
Welcome. Welcome.
yeah, sure. That's all right. Have you had a minute to calm
Oh, yeah,
down for
yeah.
the ride and get, okay? All right, yeah, come on up and join us.
I should go very close to that.
Yeah, you can,
Yeah.
yeah.
Right down there, so you can make better contact with the commissioners and so on.
And you can even move that little thing a little closer.
And I'm here for support.
Well, thanks again for your patience. It was quite an adventure. Being stuck for the last 15 miles behind a car that was going. It's been more fun. Yeah. So Amy said that she gave you a little bit of background, but I'll just you probably know Heather and Amy.
Yep, I told them.
Okay.
I gave them just the context of extension, ag experiment station and UNH, like the
Perfect.
teaching, research and
Yeah.
extension loop.
Okay.
I told them why we were here
Okay.
and that there's federal money.
Yeah.
But that's about what they got from me.
Perfect.
Okay.
Yeah. I think the idea has been honestly percolating for many years. In that one of the big advantages in our agricultural research enterprise at the university is that it is most of our agricultural facilities, which are the shared labs where scientists do the science, are within a 7-mile radius of campus, which is great, super convenient for scientists, for our grad students. Doesn't really represent the entire state very well. It's a pro and a con. And where when Amy and I have talked, when Heather and I have talked, where there are opportunities, and I think where there's a tremendous growth opportunity for agricultural enterprise, teaching, research, and extension, is to have a place where scientists and research is embedded. It's located in a community outside of the seacoast, so that the person just doesn't come there on a weekend. The person doesn't come there on for a week at a time and then it's gone. They actually live there. They work with the people in the region, in the town. They understand what the real needs are from the ground up, not just for sort of at the 30,000 foot level. And we have been thinking about how to do this. And North Haverhill, Grafton County seems to be a perfect place for it. It's got county farm, it's got extension right here. Honestly, Heather is here. She's a big reason for this. She's had this historical understanding and appreciation of combining research and extension, and the idea that UNH isn't just in Durham, it's all over the state. And our extension offices are a great representation of that. How do we bring more of the research? How do we bring our students out to our group? And so where we would like to, the picture that we would like to make is there is, as Amy mentioned, this federal money through the Congressional Directed Spending Account, CDS. And what we'd like to do is propose developing a research site here at the county farm on county land in collaboration with Extension, research, and UNH more broadly. And the idea here is that we have a farm whose mission is already that research, teaching, outreach, extension. We have an extension office right here. We have extension professionals who are here in this office who know that tripartite mission really well and are engaged in it on a daily basis. And the idea is that the money would bring the infrastructure. So thinking about a small lab, but true research lab, a place where a researcher can come, live here, work here, interact with the communities here, and then maybe 2 or 3 tiny houses where we can have people from Durham drive up, whether it's grad students who come here for the summer, whether it's visiting scientists, whether it's researchers there who are collaborating with the person here. And then find funds. And we have some ideas of how to do that, to actually hire a person, likely a research scientist, who would have both a research appointment and an extension appointment to live and work right here. And we've talked to a few folks here in the area who we think are supporters and could be real champions, stakeholders on the ground, that they seem to be very intrigued by the idea. I think the the concept of bringing UNH out into the communities, really be embedded in a much more diverse way is really attractive. And this would, honestly, this would be a pilot in many ways. And I think this could be a way for Northern New Hampshire, for Western New Hampshire to be a lead in the state to showcase what can be done with an innovative approach to UNH continuing to grow as an institution that can represent the entire state by being in the entire state. So that's the idea. Maybe I'll stop here and see if Amy and or Heather want to add anything, and then see if you all have questions.
Right here, yeah. So there would be a structure built to provide that workspace, and then also accommodations for somebody to, you said a few tiny houses. And would the person who, the head researcher, live in one of those tiny houses, and would that be on county property or?
Good question. I'm not sure.
Okay,
This is
right.
very early on.
Yeah.
I'm just sort of giving you what we've thought about, and obviously with any kind of construction or any kind of planning, local ordinances and planning boards, et cetera, would have a lot to say about it. And obviously the county itself, because it presumably would be on county.
Yeah. What did you follow up?
Yeah, please.
What did you say? I think you said earlier what the amount of the grant is.
It is typically it's right around $1 million. So this is from the USDA Rural Development Fund. This would be the line where this would be appropriated. This would be through the U.S. Department of Agriculture. In the past, that they give amounts between about 600,000 and 3 million. I'm not sure what this would be. Probably in the million to 1.5. Something like that, but I don't want, this is recorded and it's on YouTube, but this is just an estimation, right? Like construction costs go up by the minute, so I'm sure it's already 2 million. But I'm really not sure.
Thanks.
My guess is it would roughly be around.
One more. So what you're possibly looking for is commissioner approval to start a conversation with the town of Haverhill.
That's exactly right. So the way that this particular program works and this particular appropriation works is that the university cannot be the one to actually submit the application. It has to be the community, it has to be the town where this is going to be located, because the purpose of the funds is to increase economic development, increase the benefit to the town itself. And I think the university will be a big help in writing the language and developing in collaboration with the town. But yes, it would have to be the town that proposes ultimately to one of our federal delegations to put in this request.
So can you give us an example of how these particular type of funds have been used for something similar to this in another university or state or something?
Yeah, it's in other states where there is much more. So UNH is a bit unique in that all of its agricultural research facilities, I'd say mostly, because Heather has used the high tunnel here. We have a research going on here at the dairy farm. But most universities have agricultural research facilities that sometimes are tied to extension, sometimes they're not. They're in many parts of the state. Now, we also live in a fairly small state, so perhaps, going back 50, 100 years, perhaps that wasn't the thought. But given how much agriculture is changing, how much communities and microclimates are changing in our state, it's important to have that representation. So in other states, similar efforts have been put forward where the university works with local towns. I don't have off the top of my head a good example of what other states have done this. I do know in talking to the university works with a government affairs group, and this is not a surprise or a really innovative way of approaching these collaborative agreements. what my conversations with the representative there have yielded is that there is a model for this. And I think we haven't really explored that in much more detail, only because it would be moot if there was support or interest.
Right.
So once we have a better idea of what support exists here and sort of the next steps locally, that's where I think the three of us will have conversations with our affairs folks that guide us and provide us.
I have a couple of questions, if that's all right. You mentioned building a lab. What kind do you envision it as, like a lab with like a bench lab, like that kind of science, or something different?
Yeah, I think it's I want to be careful about providing too many thoughts about what the specifications of the lab should be. Anytime you go to work with any kind of chemicals, the price shoots through the roof. So whether it's a wet lab or more of a sample processing lab, like a soil scientist who wants to take samples, dry them in an oven, and work with them, whatever, do whatever kind of science there, or a dairy scientist who wants to collect samples on forage quality and analyze the plant material. I think it'll depend on the combination of the cost and the ultimate vision for what this structure like. That's as far as I've gotten thinking.
And my other question is, as we've seen funding for USDA cut, do you see that these kinds of funds will be available going forward?
I wish I had a crystal ball. I could be optimistic and say yes. I could be pessimistic and say absolutely not. I think realistically, it's hard to answer that question. Yeah.
And so my follow-up to that, because that I guess is the answer I kind of expected, is I guess my concern is if we have these buildings on our complex and we lose funding, it would then perhaps be on the county to support these buildings. And as you may know, our budget is tight like everything, and we need some buildings ourselves. And I guess I'm looking to see what your thoughts would be on if we end up losing funding, how the county could be compensated or funding moving forward, or if something needed to be decommissioned.
That's a great question. I think the way that we have envisioned this is going to be a collaboration between the university and the county, and right. So there is this initial influx of funds that is championed by collaboration between town, the county, and the university. That fund that is to go toward funding the initial infrastructure development, and then it will be part of that process is going to be developing a long-term model of figuring out where funds come from, who is, how is UNH going to be involved in this. Ultimately, it's building that would be in support of UNH. I'm not sure what, maybe UVM or Dartmouth might want to take it over at some point in the future. I don't think so, but it certainly fits very well within the mission, the land grant mission of our university. So I see it as a long-term collaboration between UNH and the county and town. And there are models for this at many other land grant universities where there are remote to the campus. There are places around the state that the buildings are university buildings, and they work collaboratively with the town where those buildings are located to make sure that there's long-term sustainability and resilience.
I think it's really interesting. It's sort of what jumps into my mind is that the whole Harvard Science, Harvard Brook,
Yeah.
research place. It's not, there's somewhere in the woods out there. I can't remember. I've been there, but I have no idea.
It's in Thornton.
Thornton, okay.
So, well, your district, but my neck of the woods.
Yeah,
That-
Yeah.
That's precisely it. So Hubbard Brook is part of the US Forest Service, right? So that's an experimental forest. And the US Forest Service is part of the USDA, and they have these experimental forests all over the country. And the idea there is you can't just study a forest in Michigan and apply its knowledge to New Hampshire, because our forests are very, very different. And in the same way, yes, we can absolutely do science at our ag facilities in our perhaps more temperate, less elevated climate in the seacoast, and many of the results could be transferable and some may not. And those few that may not be transferable are actually really, really important to the success of those methods or ideas here in
Yeah.
Brown County. So it's the same idea. It is an experimental site where research happens on the ground with the stakeholders who live and use those resources living in the community where that research happens.
that's been around for, well, more than 50 years.
Hubbard Brook.
Yeah.
I think the 70s, that's
Yeah.
where they first
Mm.
studied us.
Acid rain, yeah.
Yeah, Yeah.
If I could just add to something that Anton said, so for a number of years, we have done research projects that happen both in Durham at the research farm there and here. And so, you know, we do know, at least in the vegetable world, there are differences. I would imagine that it's the same in corn and forage. And, you know, we haven't done a lot of research in the forest that you guys have across the street, but if something like this were to come to pass, something like that might be interesting to add to what you're already doing.
we have talked about in the past and even somewhat recently about housing on this campus.
Mhm.
And so it's certainly something we have discussed over the years. An interest in, you know, with all of this property, that there might be some way we can add to the housing in the area, whether it's for employees here, you know, or otherwise, but so it's not like we haven't discussed, you know, having people living here. Yeah.
I can tell you from my experience working at another land-grant university and talking to my colleagues, housing is a real barrier and also opportunity for research to be elevated, right? If you have housing, you have graduate students, you have,
Right.
you know, scientists who are much more willing to come up here and do their work here than if they have to, you know, coordinate housing half an hour. Grad students don't have the ability, or if they have to get a hotel and the hotel rates are, you know, $150 per night, if not more, during tourist season. So it's a big. I'm not sure this project would be successful without some level of accommodation for scientists, and that accommodation will absolutely provide two things here, right? One is a scientist who's embedded and lives and works in this community, and the second is a much closer and much stronger connection back to the main campus, so that we have that knowledge going back and forth without those additional barriers of how I stay, how do I get here? If it's snowing, do I have to leave right away because my, you know, hotel's checked out and now I can stay another night. So that's, yeah, it's a big goal.
Two questions. So what do you think do you think it would be not hard to find a scientist who would be interested in living in a tiny house? And I don't mean to, on the campus of Grafton County, I mean, we're up here. That's the first question. And then the second question is, how can Grafton County residents feel that they're invested in this? Because I can see where the university, and it's an effort to bring the university into the entire state, but I'm just wondering if what any benefits specifically might be to Grafton County.
Yeah. I'm gonna answer the first question. I'm gonna try to answer the second. I'm gonna pass it up to Heather.
Yeah, start thinking.
I guess in my mind, I don't see the full-time scientists living in the time, maybe at the beginning while finding, accommodations, permanent accommodations, but I feel like it's, it's like anyone else, whether it's an early career person coming in and moving here to, start their research and extension program, and then renting a house somewhere in the community or buying a house somewhere in the community, or a more established scientist who's looking to, maybe they're from this area, to move back and be closer to family, whatever. I see them just being a typical resident of this community, just buying a house and living somewhere here. I don't know. Yeah, somewhere in the region. So the tiny houses are more an accommodation to that connection back to the main campus, so that we have the ability to have people come here.
Okay.
From UNH, from Dartmouth, from Vermont. I mean, this is very central to those three universities. I think certainly the one benefit is a much more direct impact on the community from the research, right? That researcher is listening. They're going to the store. They are seeing the same people. They're seeing the farmers. They're seeing the young, middle-aged, older representation of the community. They're talking to them. They're seeing them in restaurants. They are on the ground. They are taking those ideas, and those ideas are making directly into the work that they're doing. It's not the UNH is going to have 1 day a year or 2 days a year where we have a conference where people can come and pitch their ideas, and then maybe someone gets interested. No, this is a person who is part of the community. They understand the benefits and the impacts of their work on this community. I can tell you that it works in other states. It works really well. When that connection is there, that connection leads to impactful science. I mean, this is why Heather does the research that she does here. This is why we have scientists who do the research here as well at the dairy, because they understand the importance of local place-based research and extension. So I think that it's like anything to do with scientific progress. It's not an immediate impact. And I think that the applied nature of the work that we have envisioned for this location potentially is going to be probably more impactful sooner than like a classic bench scientist who is using pipettes and working on basic science that will be really important 30 years from now. This is envisioned to be much more applied to the industries here.
Yeah, so I would just, I agree with Anton. The person who would be managing this is probably not going to want to live in a tiny house. This is be like a permanent,
Right, okay.
benefits eligible type of job for somebody, I assume, with possibly a master's degree. So probably not somebody who wants to live in a tiny house. I'll certainly think.
They're just little stations for folks coming in.
Internship or
Interns,
Exactly.
graduates, students.
I can envision a master's project here, a PhD project here,
Yeah.
where one or more graduate students could be doing the work on their work on the property.
Yeah, and I would say that housing actually is a real barrier to some of what we've tried to do in the past. For example, Extension has an internship program for students who want to spend the summer doing something in collaboration with Extension, and we almost never apply for them for Grafton County because we have no place to put them. So the only way it ever works is if we have a student who's from the area originally and wants to come home and live with their parents and have a job. And, we have not found over the years very many of those people. So the ability to house somebody while they're doing their research, I think actually is pretty critical. And then as to what the community gets from it. Most research grants that you go after, want you to have some kind of engagement, and educational activities associated with it. So it's a very common thing. I'm actually working on a grant proposal with somebody from UNH right now. And we have a grower advisory committee that we're putting together to help us refine what the research questions are going to be. There's a whole plan for how we're going to explain to people what we're doing, and how we're going to share that information back. And it ties in with what Amy was talking about with the, I think you used the word triumvirate.
Oh, tripartite.
Tripartite, thank you. When it works well, the farmers feed to extension what kinds of questions they have. We feed that back to the university and we build a research project about that. When we find out the answers, we give it to the farmers and then we get the next question and the next question and the next question. Obviously, I've made that sound a little bit more simple than it really is, but that's sort of what the community would get. Like right now, most of the research we do is related to vegetables and soil health because those are my specialties. There are some farms in the area who have waxed poetic about corn trials that used to be done in this area back in the day when we had those kind of resources. So I think there would be a much broader range of questions being asked of UNH if we had more capacity and more access to scientists to address them.
Thank you.
I'll add just one other, this is much more intangible. And it's revitalizing pride in the county farm, right? I mean, this is the last county farm in the state. It is one that, just talking to Heather, talking to some of the folks that we've talked to, it's one of pride in this farm. And I think there's reluctance to see it go away. And so this could absolutely help revitalize the mission of the farm and what it does, how it brings value to the community and the communities and the counties and the state's pride in this location where it's the farm that employs people from local communities. It's a farm that then gives back knowledge to that community. So obviously much less tangible, but certainly be important for civic pride.
So the ask for today is.
I think the ask is obviously that the county farm is on county land, and it's a really important piece to the puzzle. It's the ask is to see if you have any serious concerns of us continuing our journey of figuring out the next step of whom to talk to, and it's likely going to be someone in the town of Haverhill to see what their support or lack of support is, and what their questions and concerns are, and then if all is well, then we would put together a language together with the town and submit it. And I think having a letter of support from the county would go a long way to showcasing that not only that support, but also the fact that we can work with the county farm and in a tangible way rather than here and somehow we'll figure out. So I think right now it's if you have real major concerns or questions that, so we've talked about some and they'll be useful to flesh out. But if you have other really major concerns, or if you think this is not a good idea, this will be a great time to let us know and we can stop our progress. Or if you think it's something worthwhile continuing, we'll.
So I think I just heard you say that, so that you would work to, talking with the town, obviously, and working on a grant proposal. You might have said with the county's help. I'm not sure if you said that or not.
I think
What would be the input of county staff in terms of time, effort, that sort of thing?
I mean, to be honest, these these appropriation requests are fairly short. I think it would be to just look over and make sure that we do not say anything that we're, is misleading about the county farm itself, and what its operations are and could be. I'm not sure. I think it's the collaborative but not leading the effort. I think we would take on the heavy duty, leading the effort part.
So it sounds like there's
Thank you.
still some back and forth that you may come back, say, go to the town and talk with them. Have some more ideas or whatever, and come back to us with
Yeah, there
more
would have to be
details.
quite a lot of discussion along the way, about location on.
Yeah, that's what I was thinking, yeah.
And, maybe just things like tying into any other infrastructure. Did you want to mention, this is a little bit of an aside, but a conversation that we did have with the county farm manager?
Yeah, we did discuss this with him before we
Okay.
asked for this meeting because we felt like if the farm wasn't in
Yeah.
favor of it, it would
Yeah.
not be good to continue. And Glenn is very open to the idea and
It's a big
supportive
thumbs
of
up,
it.
yeah.
And what does the county administrator, the thoughts that you have at this point in the discussion?
Upon initial conversation, it seems very interesting. I think seems like a really good opportunity. It's interesting how the pieces will all fit together, being county property and so on and so forth, but, I don't have any hesitations, major, we shouldn't do this type of reaction at this point. I know we've applied successfully for a couple of congressionally directed spending appropriations, and the applications are not overly complex. And I think certainly any data that you needed from the and whatnot, I know that Glenn's very in support of this idea and would be willing to help out with whatever information that needed to come, at least directly from the farm.
So. Go ahead, Leah.
I was gonna say, I think it's a really interesting idea, and I think it would be great to have it in this part of not only the state, but that's part of the county. I think my questions going forward would just be any financial implications for the county as we're all running really close to the edge. And it would be great, because I think it's a really good opportunity, and that would be my only thing as we go, if I would be in favor of moving forward, but really looking at potential financial implications.
Michelle?
Yeah, so I share the same concern about financial implications. I also think that it's a marvelous idea and very forward-looking. Just a word about the farm, and I really appreciate, Anton, what you've said, that it's an opportunity for residents to take pride in the farm. The relationship between the delegation and the farm is a tenuous one. I appreciate the enthusiasm, certainly that the current farm manager brings to the future of the farm. But it's very problematic across delegations. We've made changes on the farm, including reducing our dairy herd to try to make it viable, but I'm just thinking of things that I've heard in the past. Somebody down in Bristol doesn't necessarily see the reason outside of nostalgia. I'm using exact words at this point, outside of nostalgia to have, because the farm, of course, doesn't run at a profit, if I'm getting that right. And we're trying to get it to at least break even. So that's tenuous, and I worry about that. And then the conversations that we've had about across boards of commissioners, and of course, we're the current board, so I understand that, but across boards of commissioners and all the stakeholders, including, the local community, is what to do, what goes on the campus, how it's developed, how the land is used. There's all kinds of concerns that come up there. I guess my biggest concern, I might be the more reserved of the three of us, I'm not sure. My biggest concern is, proceeding with something that looks really visionary and helpful, but that involves the county, and I'm trying to say this in a way that I just don't sound like an old New Englander, but that involves the county in something new, a new project, when we have many challenges right now on campus. And then if the county farm were not kept in operation in years to come, then what would happen? That's that sort of thing. Those are my concerns.
I know, I was just looking at the expense sheet and right through December, right? Yeah. It was actually, there was a positive.
Was there?
I think so.
Okay.
Isn't there? Am I seeing, because it's not in red, it's not in red, right?
I think if I could just offer a thought that I think that this opportunity also gives us another reason that the county farm does good and is beneficial and is a reason that we should keep the county farm around, is if we're tied to UNH directly and we're doing research that's beneficial to the community, then we're serving the purpose that we've set out to be as an educational county farm.
Yeah, can I just?
Yes, I mean, Jim is not here.
Jim's
so
not
I'm
here. If I could just comment, I agree, but it's still at taxpayer expense. And that's been a really controversial issue over my time here, and I don't see it going away.
I think on that note, I would say that I think so far this year, things have gone well. The farm, I mean, remember the decision we made to have someone come in that was focused on that.
Yeah,
Financial aspect of it as well, I think has definitely made a difference, and so far. But we'll
Well,
see.
I mean, I think what you have to remember is that this year, the price of milk is deplorable.
Right,
and,
true.
There's no matter who you have or what you have been here doing. Our main operation is dairy, and if the price of milk is $17 a hundredweight,
yeah. And
all the
so,
good things in the world aren't gonna make up that deficit.
I guess just to, not to carry this on, but I do worry about the farm, and we have had conversations about getting out of the dairy business. And now we're finding that it's causing, a difficulty with revenue because we're in the dairy business, and trying to think now, did I lose my train of thought? I don't think I did. I just that's all I have to say.
I hear you. So I completely agree that and this would probably be a significant deviation from the status quo. We'll take a leap of faith, right? Because it's introducing even though extension has been here for a long time, it is introducing UNH in a not a 2-year project that will conclude, and then Okay, after that, we don't have to start any more projects. This is introducing UNH in a long-term trajectory of working closer together. And there's always going to be risk in that. And, obviously I'm perhaps biased and wearing rose-colored glasses. I think that the leadership at the very top at UNH that we have now with President Chilton is very good. And like any other public institution, public agency in New Hampshire, I think there is uncertainty, and I think her leadership is going to help our university overcome that uncertainty and come out better on the other side. How long that will take, I don't know. I wish I had my crystal ball again. I got it. Snow. But you're absolutely right. It will require some leap of faith on both sides, right? It will require a leap of faith on the county and the town to say, yeah, this is going to be a new infrastructure project, and we are going to have a presence, a different presence. The farm is going to be used for different purposes because we're going to have someone here who is always thinking about that research, extension, interaction, and integration, and to be thinking about what is the next project that I take on. It will be different for UNH. UNH has a bunch of properties around the state, and this is yet another one in a time when the university is financially uncertain.
Yeah.
And so it is going to take a little bit of faith on both ends. I think ultimately where land-grant universities why they have stuck around, why there's, in my opinion, my lifetime, we won't see a closure of a land-grant university because it's so mission oriented. And I think the mission of the farm and the mission of what it was designed to do and what it is still striving to do is it's a long-term education, research, extension mission. And if that continues to be a priority for the university, for the farm, for the county, I'm an I choose to be an optimist and say that there are ways to develop financial models and recalibrate them as needed. I completely agree that this is, again, that the financial model, it's a chicken and egg. When do we start working on the weeds and the financial model for long-term sustainability versus getting the idea off the ground, because we could spend a whole bunch of time on a financial model. You all, and you say, this is a terrible idea, we're done.
Yeah.
So I guess we're deciding to go at it from let's get buy-in for this initial step. And if there is buy-in, there is going to be parallel efforts on CDS requests that, in my experience, sometimes it's you request it and then second it goes in, it's such a great idea, it gets funded and gets more money than you want, right? That never happens. It takes at least a few years to get the relationships and the idea through, and so could it happen this year? It could. We have a pretty significant champion in Senator Shaheen. She's on the Senate Ag Appropriations Committee, and so that's a plus. Is Congress going to stick to its timelines? Yeah, crystal ball. Ball. Anything can happen. Anything can happen. So it's hard to know, how to make all the timing align.
Yeah.
I think right now it's, I think in some way we're coming to you to take a little bit of that leap of faith and say, yeah, this sounds like a good enough idea that aligns with the mission that we're willing to continue to have these three do the work to figure out the next step, and talking with the town and talking with our government affairs folks to see whether this is viable and worthwhile moving.
What's the timeline for the CDS application?
I know that Senator Shaheen likes to have them sometime at the late February, early March.
That's what I think.
So she's
fair.
kind of given her appointment on this committee. I think she will be the one that we approach to see if she is interested in supporting this. And I know that we have been working, Amy and I have been working on the last several years, really building up our relationships and conversations with all of our delegations. So I think with the right vision and with the right support, I can see any of our 4 delegates being supportive.
I mean, I don't see the big risk in continuing to move forward looking at this. I think it's a huge resource that we have here in the county. And, you know, we've been interested in trying to figure out how to better use that resource for the purpose of the county, really. So, yeah, I think it's the first time someone's brought something to us in a long time that is something we should consider. And I think Cooperative Extension's been a wonderful partner for us here in the county since I was a little kid even. So, you know, I think it just sounds like something we should explore, continue to support that.
And I'm in agreement with that. I think it's worth going forward with the conversations. Do we need a motion?
To
Uh,
is there
to just to
consensus
continue
or-
with
Is there
conversations.
consensus or do we need a motion?
That
That's
was
the
my question.
It's to, I appreciate everything that's being said. I'm feeling cautious, but I mean, I want to support. So tell me more about the conversation. So the conversation is with the town of Haverhill and the federal government. And then in terms of a financial plan or financial model, the county in terms of being ensured that the county isn't taking on doesn't suffer any losses. Or take on any additional expense. So,
Yeah, I think I'm totally, this is off the cuff, so please jump in. Kind of the next steps would be for us 3 to have a similar conversation with the town.
yeah,
So ultimately, they're going to be the ones who have to be the champion. They're going to be the ones who will
okay,
be submitting this. And if they're not on board, then there's no reason to continue.
right,
At least not with this funding source.
okay,
If they're on board, then we would work on drafting up some language for the request, working with our government affairs support to iron things out. And I think at that point we would circulate it to this commission
okay,
and also the town for their input and for their questions and for their concerns. We would incorporate those in that need to be incorporated. And I think we would submit it and we would start working on something that is a financial and operational plan.
okay,
Because again, the likelihood of it being funded, who knows?
Yeah. yeah,
Anything, it's always 50-50 chance, right? It'll happen or it won't. No, I'm kidding. It's yeah, I mean, who knows the likelihood, but I think if the 3 of us, if the 3 parties involved at least made that step to make the submission.
Yeah.
That's a pretty good indicator that even if this doesn't go forward, there is enough buy-in and there's enough interest that at that point it becomes worthwhile to develop these more long-term financial and operational plans, because even if this doesn't work, we can continue pitching it and trying to get these funds elsewhere. So I think that in my mind is the plan forward.
well, thank you very much, and so I guess the decision comes to me as to whether there would be a motion needs to be made or a consensus. And so I just want to say how much I appreciate all of the points and everything. But I don't, but I'm cautious about this, so make a motion and, yeah, and I'm pleased that for you and for I don't know how it's gonna work out for the county. I don't know how the delegates would feel about it, so, but I'm happy for any success with your project.
So a motion to continue the conversation with UNH Cooperative Extension.
Yeah, I would make a motion to continue the conversation to see where it leads us. At this point, we're not promising any funds. And that it is just for conversation and exploration.
And I would second that. Any other questions? Okay, all in favor?
Aye.
Aye. Those opposed?
Nay.
Okay. All right.
Very much. Time.
Thank you.
Appreciate it. Yeah,
Thank you.
we'll stay in touch. Yeah, for sure.
Thanks so much.
It's been a tougher morning than I thought it was gonna be.
Yeah, it has.
Starting with, 9 o'clock, sharp.
Well, thanks for your time.
Yeah, thanks so much.
Thank you.
I appreciate
Yeah,
your
you too.
patience with my.
Oh, no problem. I'm sorry for the, I'm happy
The
you're
sun, it
safe.
looks like the sun might
Yeah,
be coming out.
yeah.
Oh, right here. Beautiful.
Right here, true.
Thank you.
Thank you. Drive safely home. That's Jim to, kind of a little short, but that's all right. Okay. And Jim, given we're half an hour late and some of us have places we need to be, do you think we can give us the high points and anything, and sorry for that, but.
Yeah.
It's been a crazy-
Do we wanna go over the landscape bids? I mean, I've
That would be great.
evaluated them and, I've got a recommendation. So,
Wonderful, okay.
So on the back page, it just gives a breakdown of the bids. You can see Murray's is the lowest. The other ones were quite a bit higher. And so well, Julie had the same feeling, hey, what was missed,
Yeah.
And so when I broke down each individual line item, it gave me more comfort level in their particular bid. So for example, if you look at mobilization, which is line item 1, Murray's is substantially lower than Turnstone's. Breadloaf didn't give me this number. They mixed it in with all their contractors, so I have no idea what it is, but Murray's is a local company out of, well, it should be Bradford, not Bradford. Bradford, which is just across the river here. And so anybody they bring to the job will be local, they'll be going home at night, so you're not paying for hotels, you're not paying for meals and all that stuff, whereas Turnstone would be coming out of Nashua, and I'm sure they'd be sending people up and, you'd incur some costs there. So that makes sense. Anyway, I did that whole process down through here and dissected and using that same similar logic, I don't see anything that stands out that would preclude using Murray's for this. They've done a similar job of similar size. These other companies probably have a lot more experience, but it seems like there's a lot of overhead that's gone into their bids. So my recommendation, unless you have some specific questions on what you're looking at here on the spreadsheet, is to.
I think the birdhouses and so on would be a real shame not to have something like that. I just,
Ourselves.
So that was very nice, Paul. And, once again, the amount that we have left over from Craig's grant will not cover Murray's amount. And I think Julie had mentioned that there was ARPA interest money, and then there was some other account that has excess that you would have to decide, hey, is it okay to use it for this project? That's a topic in itself. But my feelings and Craig's feelings were, as taxpayers, because you're getting the taxpayer money now for some of this. I personally wouldn't want to spend that kind of money on birdhouses and obelisks and all that stuff. So it's something that perhaps maybe you can buy from some other source and do it ourselves.
Using some of that ARPA funds, using the ARPA funds.
No, just taking it out altogether, not doing it right now, but maybe next year, you know, if we wanted to do something like that to add to it, we could certainly do it in-house for a lot less money than what you're looking at here.
$100 is a lot of birdhouses.
Yes.
Yeah, it's just but just that idea that we're leaving out something that brings probably the most attractive
Joy.
thing to enjoy to the residents would be sad. I'm just, I mean, that's what I see as the a lot of older folks. I mean, the birds that you bring in and the conversations and the education and studying of, yeah, it's
I
just,
had my binoculars
I
just
know.
yesterday looking out into my
I'm
yard
the
saying,
same
could
way.
that possibly be a purple finch at
Yeah.
this? Yeah.
You could go
we had 'em at
online to
ours.
Amazon and buy birdhouses for $500
yeah.
that would do the same thing.
Okay, well, I
you
guess
know?
my concern is that we not leave that piece out of the project in some way, that maybe you leave that out of funding from Murray's, but that not be left out, because that, I think, brings
Mhm.
the point of getting people out there and doing this is.
Yeah, I'm not saying not do it. I'm just saying we could do something like that ourselves for a fraction of the cost. I mean, if you want to approve that and when we go to sign contracts with them, we will remove that line item from their contract and we would just take care of something like that in-house.
Yeah, I just want to make sure we don't leave out that enjoyable part of doing all of this.
So, I think we figured it was roughly around $60,000 more than what's currently in the budget. So you'd have to pull that from the ARPA interest or this, Julie, what's the other account?
The LATCF.
That means nothing to me, but I'm sure it means
Or
something to you.
service money.
So with Murray's, with Murray's, it's 60,000.
Yeah,
The
exactly.
amount.
So,
No, it's not, I mean, we've already spent grant money for all the design, so we have about 725,000 left. So,
the grant was at 750. We've spent roughly 25,000 for architect and engineering for the project. That leaves us 725, and yes, so they're about $60,000 over what we have left.
And that can possibly come from LATC or ARPA.
that absolutely can come from that.
Yeah, I don't mean that
decision
it
that you
can't, of course
guys.
it can.
But I would advocate that you actually approve more, because with any project, you're best to have some sort of contingency, and I advocated that, you know, instead of 60,000, let's just allocate 80 to it, and that way I have contingency, and obviously if we don't spend it, it goes back to where it came from.
I want to hear a little bit more about the birdhouses because I also think that they're really important. So how is it that you can, I'm sorry, our maintenance department can do it for 500, but Turnstone, but all these other companies say, oh my gosh, Turnstone, it's 11,000. What's up?
It's a good question. You know, it just, to me, it
Their
seems,
markup, it's their time and labor, it's, all the other things.
What do
that
these
go into
birdhouses
it.
look like?
That-
And how many are there? And
I can't give you that level of detail in this
what's the
meeting. though.
obelisks? I mean, I know.
My understanding was-
But
I think, aren't those like the Saphir?
Yeah, I was gonna say the
spherical
colorful
balls that
things.
are on like some sort of mount or whatever.
Some things that
It just, to
twirl in
me,
the
it's,
wind and.
yeah, I think that's really nice.
seems like a lot of money for what it is, you know, I mean, the average taxpayer probably wouldn't go out and buy these themselves and may take exception to the county spending that kind of money, especially if the county can go out and buy the stuff directly and add it to the project and save.
So it was in the design, though.
It's in the design. So
I know.
without getting into, I'd have to post the design to
Yeah.
see the counts and what they look like and all that.
I'm just worried that it's an important part of the design of the whole thing. Yeah.
I'm not being clear. So I agree. And so if maintenance takes it over, if we were to do that in-house, would we have the obelisks?
I'm sure we could.
I will say that, having, I've definitely not done a garden on this level, but looking at bird houses or bird feeders or obelisks, if the $6,000 seems a little extreme, then we could still be able to afford our residents the opportunities to watch the birds, whether it is a fancy birdhouse or or a bird feeder, in the winter only so the bears don't come. But that would be the issue. You can buy wooden bird houses that are put on, I have several in my yard that the birds will come and live in the summer and move out, and they are, certainly not anywhere near $6,000. I think we could look at artwork. We could also look at, there's a variety of ways to do it. I think if we're trying to make this, we have $725,000. I would rather not go, I think we obviously have to use some of the extra money if we're going to go ahead with the project, and I think we should. But I think that would be a spot that we could take out, and then there would be, it may be a few thousand, $2,000 or something, but I think if we can economize, we should.
Yeah.
We don't want to not, have plantings, but we could find a different way to do some of the adornments.
Yeah, I just think with the design, that's an important part of the design is to have that, and it would attract the birds and so on. So whoever the designer was put this together with the idea that there was going to be, those things were going to be adding to it in the places that they have suggested and the different kinds of things that they want to attract. So, and I do think that is what the older adults, yes, some of them may be interested in the fruit trees and so on, but I think most of them are going to be watching those birds that come in. From my experience with my neighbors, everyone's always fighting over who's got the cardinals and who's got the finches and what are you using? That's what you hear.
So things along, we just agree that we're gonna get birdhouses and obelisks, so we're just not gonna make it part of the contractor's agreement.
Or do you want to keep it in there?
Or
Just,
do you wanna keep
I
it
need to
in?
know what to do.
Right,
I just think for that amount of money, that it's half the price of what the other one suggested. That personally, I think it's easier than you guys. It's gonna cost you all that money to put it up, and time and effort and all that.
So you're suggesting just leave it alone?
That's
and-
just me.
Okay,
That's just,
that's,
I just think it's one of the most important parts of the whole
feel the
thing.
same way?
I feel the same way. I feel the same way. I just think it's probably intended to, I think just like,
All right,
it's
so,
intended to be beautiful, and it's the second least expensive.
Yeah.
Yeah, okay, yes, I think we should keep it in. We got ourselves into this. And I will say for members of the public, we take our responsibility, I think all of us take our responsibility to the Grafton County nursing home residents extremely seriously. I think it's a very important service.
It's a quality of life.
It's a quality of life. You're darn right it is.
all right, so what we're looking at then is, I'm looking for approval for the Murray's Market proposal amount, along with an extra 80,000 in contingents, to cover the deficit is what's there in the current budget and what needs to be approved in order to do the contract. Either using ARPA, you decide which fund you want to use,
Yes.
and then that gives me some contingency. So that's what, and we'll leave the project as is.
Like motion.
I'll make the motion.
I'll second
Oh,
it.
Okay.
I need you to narrow that motion down to say what you're using the money for.
So the 725,000 is from,
Well, right, I know that, I mean, the
Okay.
additional funding.
and the additional funding of 80,000 for contingencies would come from either the ARPA interest or the LATCF. But primarily the ARPA interest. So we want to.
Yeah.
Does that work?
So you wanna allocate $80,000 in the ARPA interest account to pay for the balance of the project over the grant?
Yeah.
Gotcha.
Just. So the motion's been, we've made the motion and it's been seconded, correct?
And I will say, I only want to make a comment that I think we need to go ahead with this project for $6,000. I'm not going to argue.
Exactly.
And I would vote in favor of it, but I do appreciate, and it goes to my heart of trying to save that money because that's what I do at home, but I do think we need this project finished.
So we have a motion and we have a second.
Yeah, it's the other way around.
Second,
Okay,
and I
made the motion.
and I seconded.
So all in favor?
Aye.
Motion
Nice job.
passes. All right.
Better
Thank you, Jim,
votes.
for all this good work on this. Looking, that was a lot put together. Those three.
All right, everybody get a copy of the monthly report?
Yep.
Okay, on page 1, under the complex, I wanted to give you an update on road salt. You're probably all aware that we at Grafton County piggyback on the state's salt contract every year. We have an agreement between Highway District 2. And basically, we store all our salt down there, and the agreement was we wouldn't buy it from any other source because they didn't want to commingle from different sources. So anyway, every year I usually have some extra salt left over from the previous year. And then I wait for the foreman down there at the local shed to tell me when to place an order based on when they have room to receive it. I placed that order on New Year's Eve. Well, it turns out Morton ran out of supply at their depot down in Portsmouth. And basically that's had a domino effect across the state. And what's happened is some of the towns around haven't been able to get salt, and we haven't been able to get salt. We've been turned off from the state until this supply issue gets resolved. I've been on the phone with Morton, their government representative, and it sounds like I might be able to get some salt out of South Portland, Maine. And that may happen this week. I've just been bird dogging them for the last week trying to do that, but there are many, many other customers that are backed up that are before us. And so, we've plowed, but we haven't been able to put salt down like we'd like to. We have ice melt that we still keep at the doorways that we put down around the doors and all that, but it's just a situation we've never run into before. I just wanted you to be aware of that. Moving down to the courthouse, we had a mop closet. We had to replace a faucet in. Plumber, when he isolated the cold and hot water in order to be able to pull the plumbing off, change it out, and then go to turn it back on. But when he went to turn it back on, the cold one, the valve busted inside. So it's not leaking, it's just you can't turn it on. And that's affected a judge's chamber toilet and sink, as well as that mop closet. In order to replace the faucet, the valves, the isolation valve, I had to have a contractor come in and abate asbestos off the pipes and valves and stuff like that. And we've got the repair parts to do it, but right now we're just, a guy that's normally there in the courthouse has been off for FMLA. And the stand-ins, they've been to figure out how to isolate that portion of the building so we can do that job. Moving down to the nursing home, the nurse call system replacement project, the review is still ongoing, but you should be hearing something from Craig soon on that. The ADA door automation project is complete.
Good.
Our electrician worked with the contractor and completed that portion. We're also working with the contractor that's doing the secure care extension project. Basically, 11 more doors are getting the secure care system. We had to run some additional power to all those locations. Our portion of the work is done. We'll assist them as needed when they come here. They're going to be here next week to do that. Moving down to life safety. We've just completed a annual requirement of inspecting all the fire and smoke doors in the building. There's over a couple hundred doors. It takes you longer to fill out the paperwork than it does to do the inspections. But anyway, it's taken several weeks to do this work along with other work that we're doing. We have a few doors that we have to replace smoke seals on. I'm waiting for them to come in. Oftentimes we get cross feedback from different counties whenever the surveyors come in there. We got Craig got feedback from Glencliff. Apparently this year they're looking at canopies coming into buildings and stuff like that to make sure that if they're made of anything of that's combustible, it's got to be sprinkled within the cavity of the canopy as well as underneath.
It's a canopy.
So like, for instance, your portico coming into the main entrance of the nursing home, that'd be an example of canopy, okay? So back in 2009, this came up, same issue. Eileen Bolander was here, and we went through all that, and we ended up having to sprinkle like the old 69 entrance, which used to be the main entrance to the building. Back it was just the 69 building in this building, and front and back. And anyway, at that time, that was the only one. No, there was an employee entrance in the 03 building had to be done as well. And so I had documentation showing that the portico for the nursing home was made of non-combustible materials. Craig asked me, he says, can you guys somehow get in there and just validate that? And so, you know, not only we look at that, we looked at others, and ended up having to put a hatch in order to get into it, because it was, you know, a sealed item. And we did see some evidence of a little bit of wood used in some areas, but it's 99% of it's just heavy steel and you know, exterior gypsum. So I sent that info down to the state life safety inspector, and he said, what you showed me, he said, don't worry about it. So that was a relief, because it would have been pretty difficult to get it out there, because there's a huge steel I-beam that would have been a problem trying to get around. Resident bathrooms, get a few bathroom floors, vinyl floors that are starting to lift a little bit at the entrance. We've got valley floors coming in to take care of them on the 30th, as far as putting in these ADA low profile transitions to eliminate any potential tripping hazard. Nothing's like extreme right now, but it's just, we can see where it's going and we want to take care of it. Moving to page 3, the admin building. I'm sure you've probably already gotten a report from Kelly about the condition of the steps. She made it a point to stop on my employees when he was shoveling to make sure that he knew that she'd be taking pictures and sending to the commissioners, you know, the further degradation of the steps. So anyway, what it was the company, when they came in here 2 summers ago and did that, they didn't use the right cement on that. They used a hydraulic cement, and then they sealed it fairly quickly. And so we had, as you saw last year, it was pretty bad, where it had cracked and started breaking apart. Well, everything that did that this past summer, they came back under warranty and took care of those. And we made darn sure that they did the concrete part right.
Yeah.
The areas that they repaired with the way we told them to do it
Mhm.
have survived. It's just, there's one other area to the left that didn't manifest itself last winter, that is this winter, that's got to be reaccomplished in that manner. So,
Well, before you hear it anywhere else, the steps were slippery this morning in our crazy snowfall that we got. So I realized that was a, like, you know, moment in time kind of thing.
no, you know, we come in, and it's like this morning we came in, and you know, the buildings that aren't used over the weekend, oftentimes the steps aren't done on the weekend, but when we know, like this building, people rolling around 8, you know, we're all over as far as getting them shoveled off, and they were shoveled off, and then we had a little bit of a squall come in behind us, and that's probably what you saw.
Yeah, it was like 9 o'clock and it just.
Yeah. And they're back out there clearing things again a second time, so. Moving down to the Department of Corrections, that security glass came in for cell A09, and that has been replaced. The camera system upgrade project is complete. Cornerstone, when they come in, they only had roughly about 2.5 days of availability to do this project. We did a ton of work on the front end to support this, and then there were some things that we had to clean up after they left that they didn't have time for. So, but we got one area left that we got to finish cleaning up, and that's pretty much done. Just an update on the underground storage tank. Told you about, we had an incident where one of the employees had started to polish one of the fuel tanks. That's basically filtering the fuel. Had started to pump some fuel into an interstitial space, had immediately realized his mistake, stopped, pumped it back into the main tank. And initially I reported that I thought it was glycol that was in that interstitial space. And then based on our research, that would have been really bad as far as the glycol in the fuel and contaminating the roughly 6,000 gallons of product that was in there. Well, it turns out after talking to the tank manufacturer and the installer, they use one of two things. It's either glycol or a calcium chloride brine. Turns out ours is a calcium chloride brine, which was our saving grace there on that. So that installer, I was able to get him to come here. It's MB Maintenance. Turns out there was probably maybe a gallon and a half of diesel that was pumped into there. We were able to get it out of the interstitial space and then service it back up with the brine. So that was good. Then, you know, we've polished the fuel once and sent off fuel samples to have that analyzed. Everything came back. They do say that we need to polish it some more because there are a few minor particles in the fuel still that need to be taken out, but nothing related to the brine being in there. You know, I've talked to DES about this as well, and the feedback I'm getting from them and MV Maintenance is you don't need to move anything. You know, once you're done polishing, you should be good to use it in the generator. So the cost of this accident or mistake this person made is going to cost us about $5,400.
That's far
So
less.
far
than-
cry from the 100 to 1,000 that were.
Yeah, that we
Yeah.
were worried about.
Yeah.
Or was reported to the House Committee last week during a
Right.
House hearing.
Exactly. So just,
And letters to the editor.
Mhm.
yeah, shooting at the hip and
Well, you had all the information.
Mhm.
Well, we appreciate you following through with all that. and
so as of right now.
Letting us know ahead, you know, as it happened. I think that's important and then, you know, we can see the whole.
Well, you know, as much as I didn't want to tell you about it, because I mean, it
Appreciate it.
reflects poorly on the department. We had a breakdown in the training there as far as, you know, there was slight differences in the tank and the guy made a bad judgment call, you know, and, you know, we've addressed that. And, but anyway, I try to be as transparent as possible.
Mhm.
I'm going to go over to the farm or the pig barn on page 5. If you see something in between that catches your eye and you want me to talk about it, I will. We were having problems with that alarm system would go into trouble. We found a couple things that we thought were the cause. We corrected those and it was good for a few days, but then it came back. So we knew there was something persistent that was intermittent. I brought Alarmco in. It's a company that's a local fire alarm company we use out of Bradford. They looked at it, got the same result, and then basically came to the conclusion that, you know, there's something with the circuit board in there. That panel is not that old. It's still under warranty. And so they've gone back to the manufacturer. The manufacturer produces them on an as-needed basis. So we're waiting for a replacement panel. Okay. So the system still works. Just tells you that there's a limitation in its operability. So we're waiting on that to come in. Over at the alternative sentencing building, Nicole had asked me if we could take Cassie's office, which used to be the old break room. There was like a base counter with a sink and an upper cabinet and all that. And she said she'd really like to get this out of here, make it look like a normal office. And we could really use that stuff in our current break room that we're using that's in the middle of the building. So we were able to do that. Did all that work in house. The only thing I've got is Valley Floors coming in on a 30th to patch up some carpet, put some code base in, and this will be done all the way. She's quite happy with it. And then lastly, under other, in that ice storm, one of the guys had an accident with a vehicle. He was out clearing the nursing home parking lot around 5 a.m. He claims that somebody came in behind him and he saw him at the last minute, hit his brakes. He was in the big truck with a sander and he said it slid into the light pole. And it did damage to the truck. There's about $1,200 in damage to the truck. But the big nugget is the light pole.
Yeah.
It's going to cost $15,000 to replace the pole and the base. The base, you can see where the studs, or not the studs, but the anchors and the threaded anchors had started to pull up on one side, which compromised that base where you put
Oh.
a new pole on it. I mean, you look at the base and it looks fine, but it
Mhm.
compromised and everything's bent. So that's gonna mean saw cutting all the pavement around it, pulling it out, repaving it after you get the new one in, and then putting a new pole. So Samantha's got all the quotes. They've all been sent to Primex and we're just,
So Primex, our insurance, it's been sent to the insurance
yeah.
area.
My guys ended up taking the pole down because the pole, we were concerned, when the wind blows here really hard, you can see a lot of movement in the poles, and this thing was like leaning towards the barn. Didn't want it to fall on any vehicles, so we disabled the electricity to that and pulled the pole down, and we'll reuse the light fixture on the new pole. But then lastly, just, we've been down staffing because of that one guy being out for FMLA. He's been out for almost 2 months, and he'll be almost another month.
Questions, Jim, on the report?
No, thank you.
That's good news about the storage tanks.
Yes,
Say so.
I did not sleep well until,
Right,
it's just
Thank goodness.
not knowing where that was gonna go.
so that's
Oh, yeah.
great news.
I didn't see the letter to the editor.
Oh,
I'm on,
I'm on a list somehow, so.
Well, hopefully the editor gets the correction.
And this was said at a meeting down at.
Yeah, House vote, yeah, testified.
Anyway,
So it has something to do with needing more commissioners, I think.
Oh, if there were 5 commissioners, one of them would have known much better and.
well, it would,
And
we would have told,
all women.
And we would have instructed, Mr. Oakes not to do any of that work on, the day
Holiday.
before a holiday.
easy to be an armchair quarterback
Correct.
and, but when you know nothing about what goes on and then, and then you shoot from the hip. Anyway,
It was sent, I don't know who, on Sunday, the 11th.
The letter.
Yeah, and it's to a BCC group, so I don't know
Oh.
who else is on it. All right, thank you.
anything else?
No, thank you. Who offered
Thank you.
that?
Thanks for summarizing that up.
Mr. DeMayo. It wasn't. Oh, no, I'm sorry. I'm mistaken. But he wrote the letter to the editor. I apologize.
I don't know, I don't get any of this.
So moving on the agenda, I sent you an opioid abatement request from Sheriff Myers. I told her that I would forward it along to you for you to look at, and she is scheduled to come in on February 3rd to meet with you to do her quarterly meeting. And I told her if you had specific questions, that we would either get them to her ahead of time, or you would talk with her more about the request when she was here in person, so.
So can I ask, it seems like from some of the departments anyways, we get those like a forum where we have all of those, the background and the motion and all of that stuff.
Memorandum.
Yeah. Can that be put in that form? I'm just, as I looked at it, I was like, wait, is it 1,700? Is it 6,400? What is the?
It's a
actual-
combination of the two, but, yeah, I'm sure it can get transferred onto that. memo.
I guess, may my question on this is that, and it actually comes to some of the conversations we were just having with the Department of Corrections is, these are first aid kits and they may be used, with people with, substance use disorder or issues related to opioids, but not solely. And I didn't know the specific rules how to tease that out, and is this appropriate for the opioid abatement or not? I can understand wanting some first aid equipment in the cars. As a healthcare provider, I 100% understand that. I'm just was unsure whether this actually fits with the opioid abatement, since it could be used for many other reasons.
I mean, there's a provision that says support first responders, under the acceptable uses. But it says priority areas may include support the education of law enforcement or first responders regarding appropriate practices and precautions when dealing with fentanyl or other drugs, and to increase access to wellness and support services for first responders and others who experience secondary trauma associated with opioid related emergency events. In reading through the documentation, I don't, it's the same thing, like, as Commissioner, you said, it's the same thing as, using nurses at the jail. It's not something that's gonna be 100% used for opiate dependent individuals. Is that okay? I don't know the answer to that, so I can certainly ask that question, and see what feedback I can get, but
My other question was around, do the deputies as part of their, I know they have a lot of training, but is first aid, or advanced first aid one of those things that they get as part of their training or their law enforcement work somehow?
I do not know the answer to that, but I certainly can ask the question.
Just I think just maybe a broader question regarding the need for this. Is this a new initiative within law enforcement? Are other sheriff's departments doing this? I guess I would say, why now? I mean, what I am wondering, as Commissioner McLeod said about the training, but what have there been incidents in which the sheriff's department was not able to help, ending in a very bad outcome?
I will forward these questions to Sheriff Myers. And we will just plan on having a further discussion about it. And I'll reach out and get some information about whether it's an acceptable use from the opioid abatement fund. And we'll have further discussions on the 3rd.
Right, because I also had some of those same questions,
Yeah.
was this in response to an event
Right.
or several events or
Right.
something like that, so.
Right, I mean, yeah, a little bit more of the context.
And I think often using that, what we get from the other departments, using that sort of format of it is
Gives it
helpful,
a
because it gives you that.
Yeah, synopsis.
So that you might want to just send her that and just say, these are the kind of questions we usually ask too, if they don't. Helpful.
This is an updated budget schedule. It's got this, it's the same dates. I just had to change around some of the departments. Commissioner McLeod, we have conflict. I gave you.
Oh, so my things have changed, but So I don't know what you've changed on here that. to
Just the
accommodate
only
that.
things I didn't change anything.
Okay.
The only thing I had to change from the version I sent you is some of the departments weren't available on the dates that they were initially scheduled for. The other change to this is that, the Register of Deeds will not be meeting with the Board of Commissioners regarding her budget. She will send her budget up, I believe on March 12th is the due date for that. And if you have questions, I will forward the questions and we'll go from there, but she does not want to meet with the Board of Commissioners regarding her budget.
So my issue is I'm gonna be gone the week of 31st. And I could join by,
When,
So for that
yeah, I'm
April
looking to
2nd
see
meeting.
what is that actual, it's March 30th, so the 31st and the 2nd, right, so that day. I could join by Zoom.
oh,
The Tuesday meeting, we probably can do, that's
what I
the
thought.
Tuesday, we probably
Yeah.
can just not.
Right, that's what I was thinking, it was actually an extra week in the month.
The budget meeting, that's some of our heavy hitters,
Yeah.
so, and they need the time. We could reschedule it to the following week. I will not be here. I'm on vacation the week of April 5th, so if you did it on April 9th, I won't be here and I will not be able to join remotely, so, nor I could probably have time to review them before I left, but,
Yeah, I won't actually be on vacation, I'll work remotely, but I will be in 5-hour time difference.
so up to you. You tell me if you want to do it on the 2nd or you'd like to reschedule it to the 9th. We don't have a meeting scheduled that day because I'm not gonna be around, so, but I will have probably had enough interaction with the departments ahead of time that I don't necessarily need to be here for their actual presentation to you.
Well, that's what I'm thinking, is the presentations as opposed to our discussion around it. Which is more straightforward. I don't know, it's up to others, I can,
I mean, I can do either date, so
I can also do either date, and the presentation also is, at least I try to ask a lot of questions to avoid having to bring them back or having to do follow-up. I try to head off. I try to get as much information as possible, but either way, Commissioner.
what are you comfortable with, Julie?
Honestly, I'm completely comfortable with either
With
way,
either
so.
way.
I mean, if it's
Colin will be
inconvenient
here.
for you to be part of it by Zoom.
Yeah.
then
On
we
the
should go to
second,
the
It'll be
ninth.
choppy, I imagine. I asked my daughter if they actually have any problem with the, there are certain websites you can't get to. Because of the way.
We
they-
can, I mean, I say we can just schedule it for the 9th. I have to check with all. the
Yes,
departments,
right.
I was gonna say,
They're
if
available on the
they're
9th.
all available the ninth, that might make sense to do that, and if they're not,
If they're
then we'll
not, we'll do it
then
by
we'll do
Zoom.
it by Zoom.
Okay,
Sounds good.
sounds good.
I will check and get back to you.
And then I will just deal with the other things and be here for that and not.
Okay.
Deal with it on the site.
So that's where we're at. The hope would be that by the 23rd or at the latest, the 30th of April, we have commissioner's budget put together. Whatever that might look like.
All right,
On the December financial reports, I believe you have December financial reports on your folders. With December, we are 6 months through our fiscal year. Looking at the monthly department variance report, the nursing home is doing well through the first 6 months of the year. They're 163,000 above revenue. They've been keeping on pace with their budgeted census. We are definitely below in our Medicaid census, but the private pay is definitely making up for that. We were below in our Medicare census for a while, but that's leveled out too. So if that can maintain or go above, that helps offset that. As you know, our rate fell, but not below what we had budgeted for, so that won't cause us any issues. So on the pro share, I mean, on the bed, so the pro share bed tax line, we have received our first quarter bed tax, and based on what we received in the first quarter, it's trending to be on target for budget. As you all know, pro share, we won't start knowing what any of those numbers are gonna look like probably until April timeframe. The county attorney's office, the VOCA grant, and the CA circuit court all show under received in funding, but those are all, the county attorney grant, the $30,000 grant that you can see we've received no money on thus far this year, is a calendar year grant, and we're reimbursed for our expenses for the quarter. So what ends up happening is we expend the whole $30,000 in the first 2 quarters of the year, so in the calendar year. So you'll see the 30,000 come in over quarters 3 and 4 for the fiscal year, and that'll be the same next year. There won't be any money in the first and second quarters, but it's just how it, timing wise, it works out. 30,000 is a very small amount of the expenditures that it goes towards. So we use those all up in the first 2 quarters of the calendar year, which will happen to be the last 2 quarters of our calendar of our fiscal year. Pretty much on target with the VOCA grant, and the circuit court thing is just we have just 1 month outstanding from the Upper Valley Prosecutorial Association. Alternative sentencing is showing below, but we have a quarterly payment that we weren't notified until Friday was coming. It was $7,000 something. So they're basically right on target. Interest, as you know, we don't have a whole lot of money this year, especially we didn't have much money in the fall for 6 months of the year. So we are tracking behind on that. I do expect to see good jumps in that in the coming months, just because now all of our funds are invested. And that, I mean, 3.5% to 4% rates, so at decent rates. So we should see that come up considerably. The other category are primarily our FILT payment and our abandoned property, which we don't get till the end of the year. So it's not abnormal for that to be tracking behind at this point in time. On the expense side, really, there's nothing of any concern. The smaller departments that are overexpended will work themselves out as we go through the fiscal year. Next month will look worse. We have 3 payrolls in January, so that definitely skews the numbers for a while. You know, definitely of some concern to me is the Department of Corrections budget, tracking over expended at this point in time. That's rare. We see that happen. I'm going to be going through and doing a much deeper dive analysis on that, but mostly that's in regards to the conversation that we had this morning with Superintendent Lethbridge, the medical, as well as overtime associated with the medical.
Yep.
And we are pretty much fully staffed, which a lot of the under expenditure in the previous short-term years has been due to us being understaffed. So we can't be upset about being, at being fully staffed. So we'll continue monitoring that, see where we're at. Everything else, is nothing of concern at this point in time. On the prorated side, if you just look at the prorated report, 50% of the years is obviously completed. We're trending basically right on track with revenue, and we're about $1.1 million under expended at this point in time. So we do have some over expended accounts. Nothing really of what I would say outside of the norm. A couple of the things on here are just, incorrect postings through, accounts payable that need to be fixed. But, you know, you'll see some of them longevity, health insurance, wages in lieu of health insurance. Those are things that sometimes are hard to predict at the beginning of the year when we're budgeting. We are over, our tax anticipation interest is 11,000, almost 11,500 over what we budgeted. And then flexible spending administration account, that's over expended. That's some of that is the $500, in flex spending account funds that are given to employees who have the low cost health insurance plan. We're just having more people pick that plan up than we had anticipated, so that's what's causing that over expenditure, so. Really, that's it. Like I said, all of our tax money has been invested in the different banks and the investment plan that you all approved, so we are, back to having money invested. If anybody has any questions, that's much a snapshot of where we're at through the first 6 months of the fiscal year.
I think the nursing home being so much on target is incredible, it's incredibly helpful.
Yeah, I mean, that's obviously huge if it's
Yeah.
in the past couple of years when we've been trending, off on that. Then next other thing that's on your list is the, our other funding sources, spreadsheet that you took earlier in the meeting. With the allocation this morning that you did for the contract nursing, that leaves $347,730.50 in the LATCF fund,
347, what?
730.50. And then the ARPA will be 201,426.38 when you take out the 80,000 appropriated for the balance of the landscaping project.
And hopefully we won't have to spend.
I wouldn't anticipate, I won't say that, but, right, hopefully we don't.
Hopefully not.
Good. That's all I have. The one other thing I did want to remind everybody, the executive committee meeting is Monday at 9
That was
a.m.
my question.
I will have a commissioner's report for you later in the week. But right here in this room, 9 a.m., the executive committee, Monday.
And I let Julie know I had an appointment that I couldn't
that's right.
change, and
Yeah.
so
Yeah.
I will be a little bit late and I will come in by Teams as soon as I can.
So if you want to go through whatever commissioner issues you have, I think we only have Commissioner Ahern left online, but public comment, and then we can do that last thing as the non-public as last.
Commissioner issues.
None.
I just have one, and I'm gonna pick up my phone because it was a voicemail I got this morning. I had a request from a constituent, letting me know that, Deb Narrow is stepping down as, after many years as the executive director of Katie. And there is an event that I believe is on February 6th, in her honor for this retirement. And my constituent is wondering if, we would be able to do a congratulatory citation. And, I thought, so, and I got it on my way here. I have not had a chance to ask any questions or anything. It's just a voicemail that I thought I would bring up since it's, it's coming up fairly quickly.
We did this before with the Lincoln.
We did it to the
Woodstock.
the Woodstock.
That's right.
Moderator.
Moderator.
Yeah.
So, as I've being the newest one, but I believe it's been a,
Mhm.
a social services, human services entity that's been funded for a number of years, so I will leave it up to the two of you. I mean, and I'll vote on it, but I would say that it would,
Do we
Be-
need to vote on a resolution? So just.
and it's in Plymouth, so I would be happy to be able
Sure.
to
Sounds good.
present it if that is something we want to do.
If you could get some background
I will.
information from
I-
us, we would be able to. put
My
that right together.
constituent, they're involved, so I will respond and ask them to get as much information as we can, dates and
Perfect.
so on and so forth, and I will get that to you.
Perfect. We'll
Good.
Get that done.
So my only thing is I have to go to the Littleton Budget Committee meeting tomorrow night. And just with, I was kind of thinking, what are we doing at the, given to the delegation? It could be sort of similar outline. I mean, look at the minutes from last week on the courthouse update.
Yeah, let me, I can get the commissioner's report put together for you before that, and you can read through that
Okay.
and see if you
See
have
if
any.
it's-
Yeah, definitely, because that'll have a little bit of update on the broadband, it'll have,
Hmm.
the courthouse, where we're at with that,
That would be helpful if you can, if it is, can fit it in.
absolutely can do
I
that.
appreciate that.
If you guys, if that's it, if you just wanna do it, I don't.
See if there's any,
And I think, Mr. Ahern's microphone doesn't work.
so
Nope.
how do we know? Maybe Sam could, open that up just in case.
He could raise his hand if he wanted to.
Yeah,
No, he could.
or, Attorney Ahern, you could raise your hand or blink twice if you wanted to. Sorry, but it's public comment and you're the only public on there. Right, seeing no blinks. And no raised hand or anything else. All right, thank you. So we'll close public comment and we'll have a non-public session.
I'll make a motion to go into non-public session per RSA 91 dash uppercase A : 3, Roman numeral 2, parenthetical E.
Second.
All in favor? And Commissioner Hedberg?
Yes.
Sorry. Commissioner Piper?
Yes.
Commissioner McLeod, yes. We turned